Hi to all of my friends on board right now with me for the long session today of ENT, which is going to give us 17 marks, the biggest high yield subjects today we are going to cover for our exam, and this is your ENT. So be with me and pray to the gluteal region so that they can stood firm and strong, so that we can sit for prolonged hours or so long hours, so that we can study very nicely. So guys, before starting anything, just keep on saying I will pass, I will pass, I will pass, I will pass. Call off your friends and let's do this together. ये साथ लड़ने वाली लड़ाई है, इसे साथ लड़ा जाए. इसी बीच में एक प्यारी सी शायरी, यस, आप सबके लिए. मेरी आंखों का ख्वाब, यस, मेरी आंखों का ख्वाब दिल के अरमान हो तुम. मेरी आंखों का ख्वाब दिल के अरमान हो तुम. तुमसे ही तो मैं हूं, मेरी पहचान हो तुम. तुमसे ही तो मैं हूं, मेरी पहचान हो तुम. मैं जमीन हूं अगर तो तुम आसमान हो मेरे. मैं जमीन हूं अगर तो तुम आसमान हो मेरे. सच मानो मेरे लिए तो सारा जहान हो तुम. लव यू ऑल, love you all, love you all, love you all. Yes, done, done. Yes. So guys, now let me tell you something. For the next 10 days, what we have to focus on. For the next 10 days, don't read anything new. Just ace the things you already know. Now is a high time to make the things perfect which you already know. It's not a time to study something new, because if you try to study something new, it will take your mind and it will distract you, and because of that distraction you will not be able to recall the things you are good with. Okay, so please, it's my request with the folded hand, please read the things which you already know. Just put them on fingertips, solve the questions related to them, resolve the questions, and the game is done. You all are going to pass on 4th of June. 4th of June. ठीक है, चलो भाई, ये क्या हो गया? सूबेदार कौन है भाई ये? then allow me to start the ear. Number one topic, we are going to start with the ear, then we're going to the nose, and the last we are going to the throat. Deep throat we are going to study at the last, sir. So be with me. आज खाना पीना सब मेरे साथ खाना है. Are you guys ready? Are you guys ready that हम खाना भी साथ खाएंगे, आज पढ़ाई भी साथ करेंगे, सारे काम आज साथ में करने वाले हैं. Yes, you all are ready. Yes. Then let me start. Yes. Let me start. Chalo. Pinna develops from. Number one thing is Pinna developed from where? First and second arch. Pinna कहाँ से develop होता है? First and second arch. You have to answer along with me, and this is learning class. Pinna develops from first and second arch. There is hillock of his which are 6 in number, and they form your external ear. They form what? Your external ear. The hillocks of his are 6 in number, and they form what? Your external ear. Now coming to the bat ear. गांधी जी जैसे कान होते हैं, ऐसे बड़े बड़े लंबे लंबे. ठीक है, क्या हो गया भाई? ये कौन है? नाइस. कोई बात नहीं भाई, गाली देने दो, कोई बात नहीं, अपने काम करते रहेंगे. दुआएं भी तो मिल रही हैं, है ना? अगर 80% दुआएं मिल रही हैं, 20% गालियां मिल रही हैं, तो मुझे लगता है हमें दुआओं की तरफ देखना चाहिए, है कि नहीं? देने दो, क्या दिक्कत है कि नहीं? यस, चलो भाई. Absent antihelix. If antihelix, there is helix and antihelix. If antihelix is absent, it will lead to what? Your bat ear. It will lead to what? Bat ear. And bat ear का correction कब होता है? Bat ear का correction कब होता है? After 6 years. Guys, remember, if your child is born with a bat ear, and bat ear happens, how it happens? It is due to absence of antihelix. It is due to absence of antihelix and surgery. When you have to perform the surgery, sir, your very much answer is correct. Surgery after the 6th year. Surgery after the 6th year. Then coming to the tympanic membrane develop from. From where this tympanic membrane develop from? Tympanic membrane develop from ectoderm, endoderm, and mesoderm. Ecto, endo, meso. So tympanic membrane develop from ectoderm, endoderm and mesoderm, all three. Then coming to the ossicles, recent NEET PG exam question ossicles. Recent NEET PG exam, that is your ossicle. So guys remember, miss is a mnemonic. क्या है miss? कहते हैं मुझको हवा हवाई हवा हवाई हवा हवाई. So क्या है? Malleus, incus and stapes. Malleus, incus and stapes. So guys remember, S for stapes, S for second. तो stapes develop from second arch. तो बचा क्या हमारा MI, malleus and incus. So malleus and incus developed from the very first arch. Malleus and incus develops from the first arch. So incus image base क्वेश्चन वॉज रिसेंटली एग्जाम इन द नीट पीजी. ठीक है, इसकी इमेज जरूर देख लेना, मेलियस, इंकस और स्टेबिस की. इट कैन कम इनटू योर एग्जाम, इट कैन कम इनटू योर एग्जाम. डन डना डन डना डन डना डन. Now coming to the middle ear transformation ratio. What is a middle ear transformation? It is your 18:1. It is your 18:1. The main function of the middle ear. What is the main function of middle ear? It is impedance matching mechanism. It would be your impedance matching mechanism. Now coming to the main topic, that is your previous year question. That is your Pinna Hematoma. That is your Pinna Hematoma. So guys remember, Pinna Hematoma, why it is happening, how it is happening. The most common cause of Pinna Hematoma would be trauma, would be your trauma. किसी ने कान पे मुक्का मार दिया, उसकी वजह से क्या हो जाएगा? हेमाटोमा हो जाएगा. या किसी ऑब्जेक्ट मार दिया, इस वजह से क्या हो जाएगा? हेमाटोमा हो जाएगा. तो Pinna Hematoma cause is trauma. Pinna Hematoma, the cause is trauma, and the treatment is aspiration. Treatment is aspiration. Otherwise, if you will not aspirate this hematoma, it can lead to boxer's ear or cauliflower ear. Boxer's ear or cauliflower ear, because if you will not aspirate this hematoma, it will lead to necrosis. It will lead to what? Necrosis. तो याद रखना कैसे. किसी ने मुक्का मारा तो हिंदी में बोलते हैं चूस लेना. उसको क्या कर लेना? चूस लेना. अगर नहीं चूसा तो क्या हो जाएगा? बॉक्सर्स ईयर और कॉलीफ्लावर ईयर. बॉक्सर्स ईयर और कॉलीफ्लावर ईयर. बॉक्सर्स ईयर और कॉलीफ्लावर ईयर. Then coming to the external auditory canal. Very important canal is your external auditory canal. So my dear friends, what is the length of external auditory canal? It is your 24 millimeter. So external auditory canal, your length is 24 millimeter. What about the Eustachian canal? Eustachian canal का length कितना है? Eustachian canal का length कितना है? Eustachian canal would be your 36 millimeter. 36 millimeter. Now if you see your external auditory canal, you see your outer part is made up of, अगर कान में उंगली डालते हो, हाँ कान में, ठीक है, कान में अगर उंगली डालते हो तो outer part क्या है तुम्हारा? कार्टिलेज. और inner part क्या है? बोनी. So guys remember, if it is your external auditory canal, remember outer one third which is your 8 mm is cartilaginous and inner part is bony, which is 16 millimeter. So always remember by this, the length of external auditory canal will be 24 millimeter and outer canal would be of 8 mm and inner would be of 16 mm. 1/3 would be outer, 2/3 would be your inner canal. Now let's talk about the if wax block the external auditory canal. Now what you will do if your wax, ठीक है, ठीक है, if your wax blocks your external auditory canal, treatment is syringing, and do not use cold water because it can cause vertigo. Never use cold water, it will cause vertigo, and this is your previous year question. Why in case of syringing you never use cold water, sir? It can lead to your vertigo. It will lead to what? Vertigo. Let's talk about something known as fissure of Santorini. Fissure of Santorini is a natural defect in the cartilaginous external auditory canal. Cartilaginous is the outer 1/3 part of the external auditory canal. If there is a natural defect or natural hole present which is known as fissure, this fissure in the cartilaginous part is known as fissure of Santorini. This is known as fissure or Santorini. Done. Then coming to the disease of external auditory canal. So guys, disease of external auditory canal, number one disease we are going to discuss about the external auditory canal would be your diffuse otitis externa. Your diffuse otitis externa is also known as swimmer's ear. Your diffuse otitis externa is also known as swimmer's ear, and it is an infection of complete skin of external auditory canal. So diffuse otitis media is infection of complete skin of external auditory canal. So diffuse otitis externa is infection of complete skin of external auditory canal. Done. उसके बाद है localized otitis externa. Sir, what is present at your localized areas? Localized area, it is present what? Hair follicle. Local area पे क्या present होता है? बाल present होते हैं. तो localized otitis externa would be a infection of hair follicle. Would be a infection of hair follicle. Now, what is the treatment in both the cases? Treatment would be incision and drainage followed by ethymamol glycerin. Treatment would be incision and drainage followed by ethymamol glycerin. Localized otitis externa, infection of hair follicle. Infection of complete skin of external auditory canal is known as your diffuse otitis externa. Both the cases, treatment is incision and drainage followed by ethymamol glycerin. Done, done, done. Then coming to the previous year question. Malignant otitis externa. It is your malignant otitis externa, sir, and it is seen in old diabetics. It is seen in old diabetics, and it is infection of bony external auditory canal. That means I'm now talking about the 2/3 bony part, the inner 2/3 bony part of the external auditory canal. So malignant otitis externa, it is seen in old diabetics, means a patient of 60 to 70-year-old, and it is an infection of bony external auditory canal. Now patient would be presenting how? Ear pain, granulation in the external auditory canal, and remember guys, facial nerve is involved. What is the drug of choice in the malignant otitis externa? What is our drug of choice in malignant otitis externa? Sir, your answer is third generation cephalosporin. Your answer is third generation cephalosporin. Malignant otitis externa, treatment is third generation cephalosporin. Treatment is third generation cephalosporin. Dun dana dun dana dun dana dun. Then is otomycosis. Repeated question of FMG exam. Otomycosis, fungal infection of external auditory canal. How you have to remember this? Just remember, wet newspaper appearance is seen. Just by this word, wet newspaper appearance is seen in your otomycosis. And otomycosis is a fungal infection. Yes, it is caused by Aspergillus. Perfect. Exertosis is known as surface ear, or you can say surfer ear. Surface ear. Water sports person, what is happening? Your ear will go like this. After lots of swimming, after wearing that cap, your ear will go like this, surface ear. This is known as surface ear, and most commonly it is seen in water sports person. So sir, right now we have studied 5 disease of external ear. We were talking about diffuse otitis externa, which is also known as swimmer ear, infection of complete skin of external auditory canal, then localized otitis externa, infection of hair follicle, then malignant otitis externa seen in old diabetics, then coming otomycosis, wet newspaper appearance, and then coming to the tympanic membrane. Then coming to the tympanic membrane. Tympanic membrane. चलो tympanic membrane की बात करते हैं. Done जी, done done. चलो tympanic membrane की बात करते हैं. Color is pearly gray. ठीक है, कई जगहों पे pearly white भी लिखा हुआ है. ठीक है, it's like controversy again, but you have to remember what? Pearly gray white. Pearly gray white. ठीक है, diplomatic answer to this is pearly gray white. और angle कितना होता है? Tympanic membrane का angle कितना होता है? What is the angle of tympanic membrane? Sir, your angle of tympanic membrane would be 55 degree like this. And most reliable landmark of the tympanic membrane would be your umbo. Would be your umbo. Now, how you have to remember pars flaccida and tensa? Let me make it simple for you guys. देखो T नीचे होते हैं. T कहाँ होते हैं? T से समझ जाओ, है ना? T नीचे होते हैं और फ्लाई ऊपर करते हैं. तो फ्लाई ऊपर है और टेंसा नीचे. पार्स फ्लैसिडा इज अप एंड पार्स टेंसा इज डाउन. पार्स टेंसा इज डाउन. सो गाइस रिमेंबर, ओनली शार्प पीपल कैन फ्लाई. Only sharp people can fly. That is why it is written Sharpnell's membrane. Sharpnell's membrane is present in pars flaccida. Sharpness is present in pars flaccida, and other tensa is down. Tensa is down. Tensa is down. So down wala is pars tensa. Upper one is flaccida. In flaccida, Sharpnell's membrane is present. Sharpness are present. Done, 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 done. Then coming to the Eustachian tube. As I already discussed, Eustachian tube, the length is 36 millimeter. Eustachian tube, the length is 36 millimeter. Now, inside, bony part is less and cartilaginous part is more. Now 36 is further divided into 12 plus 12 plus 12. If I say 2/3 part is cartilaginous, that means 24 mm is cartilaginous, and what is left? It is your 12 mm which is left, that is your bony part. 12 mm is left, that is your bony part. That is your bony part. Now, which muscle is opening this Eustachian tube, sir? If someone asks you which muscle is opening this Eustachian tube, sir, your answer is tensor veli palatini muscle. Your answer is tensor veli palatini muscle. So what is the purpose I am telling you? In the external auditory canal, this cartilaginous part is less and the bony part is more. But in the Eustachian tube, cartilaginous part is more and the bony part is less. And which muscle is for the opening of Eustachian tube? Sir, your answer is tensor veli palatini muscle. Tensor veli palatini muscle. ठीक है, चलो चलो जी, उसके बाद है मिडल ईयर. लेट्स टॉक अबाउट द मिडल ईयर. मिडल ईयर, थ्री थिंग्स आर देयर: एपी टेम्पैनम, मीजो टेम्पैनम एंड हाइपो टेम्पैनम. एपी, मीजो, हाइपो. एपी, मीजो, हाइपो. How you to remember? Length is 6 mm, 2 mm, 4 mm. Just remember this because once late back one question was asked from this. That is why it's my duty to tell you. ठीक है? So my dear friends, please remember this thing: epi, meso, hypo. Epi, meso, hypo. Epi tympanum, it is 6 mm. Meso 2, hypo 4. Epi, meso, tempo 6 to 4. 6 to 4. Done. Let me talk about the sensory supply of the middle ear. Sensory supply of the middle ear. Sir, sensory supply of the middle ear is by the tympanic branch of the ninth nerve. Tympanic branch of the ninth nerve, and this ninth nerve, which is a tympanic branch of ninth nerve, vagus nerve, would be your Jacobson nerve. This nerve is known as Jacobson nerve. So who is sensory supply of the middle? Who is supplying the sensory supply of the middle ear, sir? Always remember it is a tympanic branch of the ninth nerve, and the name of nerve is your Jacobson nerve. Name of nerve would be your Jacobson nerve. Jacobson nerve. ठीक है? So nerve causes rhaphodotalgia. Rhaphodotalgia means rapid pain in tonsillectomy and tonsillitis. So which nerve is causing rhaphodotalgia in tonsillectomy and tonsillitis? Sir, your answer is Jacobson nerve. Your answer is Jacobson nerve. Done. तो याद रखना, संघर्ष करने वालों को जरूर मिलता है. संघर्ष करने वालों को जरूर मिलता है मेहनत का फल और समस्या का हल. संघर्ष करने वालों को जरूर मिलता है मेहनत का फल और तुम्हारी समस्या का हल. डन. चलो जी, मिडल ईयर क्लेफ्ट. लेट्स टॉक अबाउट द मिडल ईयर क्लेफ्ट. Middle ear cleft. What is middle ear cleft? It is a collection of hollow spaces in the temporal bone. Let me make it very, very simple for all of my friends over here with me right now. On 24th, I think 24th of May, just 10 days before their main exam, and I want to tell you, Eustachian tube. First is Eustachian tube, sir. First is Eustachian tube, followed by attic, followed by adductors, followed by antrum, and fifth part is mastoid ear cell. How you have to remember? All of my friends, how you have to remember? Please remember, Eustachian tube is coming. Eustachian tube, remember, attic is added to antrum. Your attic is added to antrum. तो attic, adductors, antrum, और ये गुच्छे जैसे क्या लटका हुआ है? Mastoid ear cell. So 5 parts. Be with me, revise with me, and you will be master in it. So number 1 is Eustachian tube. Now attic is added to the antrum. 4 parts are clear, and what is remaining, sir? It is your mastoid ear cell. What is remaining? It is your mastoid ear cell. It is your mastoid ear cell. Done. Let's talk about the disease of middle ear cleft. The next topic is disease of middle ear cleft, and remember, acute suppurative otitis media, also known as ASOM. Remember, it is an infection of middle ear mucosa by pyogenic organism. Yes, ASM is an infection of middle ear mucosa by pyogenic organism, and the most common organism would be Streptococcus pneumoniae. Streptococcus pneumoniae. Streptococcus pneumoniae. So my dear friends, along with me who are there on board, acute suppurative otitis media is ASOM, and it is an infection of middle ear mucosa by pyogenic organism, and the most common is Streptococcus pneumonia. What is a clinical feature you will see in ASOM, sir? It is your earache. It is your earache. Now, one very important sign I'm going to tell you, which you are going to learn for the exam in ASM, would be your red tympanic membrane. Whenever you are putting an otoscope inside, you will see red tympanic membrane and a dilated capillaries which look like a cartwheel. Cartwheel look like something this, which look like a cartwheel. So now my question to all of my friends on board with me, cartwheel sign is seen in which disease, sir? Cartwheel sign is seen in ASOM, acute suppurative otitis media, which is an infection of middle ear mucosa by pyogenic organism. Now comes, sir, a treatment. Treatment would be antibiotic. ASOM treatment would be antibiotic, decongestant and analgesic. Decongestant and analgesic. Done, done. Now coming to the safe chronic suppurative otitis media. This is known as CSOM. Chronic suppurative otitis media. Which one? Safe one, sir. Which we have to talk about is safe chronic suppurative otitis media. Safe chronic suppurative otitis media. Done. So poll is coming. Okay. So our team is posting the polls. Please answer the questions. Would be very beneficial for all of you. ठीक है, चलो जी. उसके बाद है, it is a permanent central perforation in the pars tensa. Sir, if I'm talking about the pars tensa, that means I am talking about the lower part of the tympanic membrane. So permanent perforation in the pars tensa. This is safe type of chronic suppurative otitis media. Now, what is a clinical feature? It is very interesting clinical feature, and that is your ear discharge. Ear discharge, but how? Not foul smelling. Safe word is there, not foul smelling and not blood stain. Not foul smelling and not blood stain ear discharge is seen. And which type of hearing loss you will see in safe type of chronic suppurative otitis media, sir? Sir, your answer is very much correct. It is your conductive hearing loss. Would be your conductive hearing loss. Would be your conductive hearing loss. And the most common bone to go under necrosis would be your incus. Would be your incus. ठीक है, चलो along with me. Safe chronic suppurative otitis media. It is a permanent central perforation in the pars tensa. Then clinical condition is not foul smelling and not blood stain. And कैसा hearing loss होगा? Conductive hearing loss. Or most common bone to go under necrosis would be your incus. Now treatment part अब फट गई है तो क्या करना? जोड़ना है. तो दोस्तों, number one is your myringoplasty. Then type 3 tympanoplasty and ossicular replacement processes. Why ossicles need to be replaced? Because there is avascular necrosis happening there. This is government incision image based question. This is a image based question. Done. Then 100% question is going to come from this topic. This is your acute mastoiditis. Now, what is acute mastoiditis? It is an infection of mastoid air cell. Sir, and clinical presentation. Remember, pain behind the pinna and the perfuse ear discharge. Pain behind the pinna and there is a perfuse ear discharge like this. This is a case of acute mastoiditis. Now, sign if I tell, ironing of the mastoid surface. Mastoid surface कैसा हो जाएगा? ऐसे चिपटा हो जाएगा. ऐसे क्या हो जाएगा? चिपटा हो जाएगा. बस दो साइन यहाँ पे बहुत जरूरी है. Two signs are very important. Now, if pus fill immediately on cleaning, you are removing a pus and it fills immediately. This is known as your favorite reservoir sign. And if pus is continuously moving, this is known as lighthouse sign. Pus fills immediately on cleaning. This is known as reservoir sign. And your pus is continuously moving. This is known as lighthouse sign. Lighthouse sign. Done. The two signs in acute mastoiditis. Now two views in acute mastoiditis for the X-ray mastoid. So two views are there for the X-ray mastoid. Guys, remember Schuller's view and Townes view. Schuller's and Townes. Now, what operation you are going? How you are going to treat it? You are going to treat your Acute mastoiditis with the help of Schwartz operation. Cortical mastoidectomy, it is also known as Schwartz operation. Then surgical landmark for the antrum in this. Also two landmarks are there, and one is your McEwan's triangle and your suprameatal triangle. McEwan's and suprameatal triangle. Done, done. Coming to the next, Petrocytis. Sir, Petrocytis is also known as Grady-Negro syndrome. Petrocytis is also known as Grady-Negro syndrome, and the mnemonic is GERD. The mnemonic is GERD. G for Grady-Negro syndrome. G for Grady-Negro syndrome. E for ear discharge. R for retroorbital pain, and D for diplopia. So Petrocytis, a very important clinical condition, is known by a mnemonic known as GERD. G for Grady-Negro syndrome. E for ear discharge, R for retroorbital pain, and D for diplopia. And the treatment is surgical management. Treatment is surgical management. Done. So let's talk about the unsafe CSOM. We have studied safe CSOM where no blood stain discharge, no foul smelling discharge was coming, and there was a permanent perforation over there in the pars tensa. Now I am going to talk about the unsafe CSOM, or it is also known as cholesteatoma. It is also known as cholesteatoma, sir. Now the ear discharge in unsafe wala, now feel the difference. Scanty, foul smelling and blood stain, and conductive hearing loss is seen in both. Safe type of chronic suppurative media and your unsafe type of chronic suppurative otitis media, दोनों के अंदर conductive hearing loss is seen. But if there is no scanty smell, if there is no blood stain, that would become your safe type of chronic suppurative otitis media. If scanty smell, foul smelling is there, blood stain is there, then it will become your unsafe chronic suppurative otitis media, sir. Then coming to the X-ray, sir. Now X-ray again for the mastoid, we are having two views. Already you know Schuller's and Townes. And what about the treatment of your cholesteatoma, that is unsafe CSOM? That would be very simple. Modified radical mastoidectomy. Modified radical mastoidectomy. Done. Then let's go for the next disease, sigmoid sinus or lateral sinus thrombosis. Next is sigmoid sinus or lateral sinus thrombosis. Guys, clinical feature would be headache, spiky fever, एकदम से बुखार ऊपर चढ़ जाता है. Then the third feature is pitting edema on the mastoid. This is known as Gressinger sign. And guys, this is very, very important. CT brain will show what? CT brain will show you delta sign. Highly important. Sigmoid sinus or lateral sinus thrombosis. Sigmoid sinus or lateral sinus thrombosis, sir. Guys, remember headache, spiky fever, pitting edema on mastoid, which is known as Gressinger sign, and on CT you are going to see what? Delta sign. Sir, coming to the glue ear. Glue ear is also known as serous otitis media. Recent NEET PG exam question. Glue ear is also known as serous otitis media. Cause of glue ear, let me make it very simple for you guys. ठीक है जी. Guys, remember in school age children, adenoid hypertrophy is there. There is an adenoid hypertrophy, and because of adenoid hypertrophy, there will be a Eustachian tube blockage. And remember, because of this blockage, your glue ear will be seen, and bilateral glue ear. So remember, your glue ear is bilateral glue ear. It is seen due to adenoid hypertrophy, which will block your Eustachian tube, and the function of Eustachian tube is to maintain the middle ear ventilation. Now the treatment part is maryngotomy. If it is blocked the external auditory canal, if it blocks the external auditory canal, then your treatment is, if it is blocking the external auditory canal, then your treatment is syringing. If it is blocking the Eustachian tube, then your treatment is maryngotomy. Sir, coming to the inner ear. We are coming to the inner ear. Let me take you to the anatomy. I know my drawing is very, very bad. And guys, semicircular canal. The number one, this foot plate is semicircular canal, followed by utricle, followed by saccule. Semicircular canal, utricle and saccule. Semicircular canal, utricle and saccule, sir. And remember, next is your cochlea. ये जो गोल गोल है ना, मेरे बालों की तरह जलेबी जैसे जो बाल है, ठीक है, ये क्या है? Cochlea. ये क्या है? Cochlea. So guys, remember, who is connecting your cochlea with the saccule? My question: who is connecting your cochlea with the saccule? Your answer is written here in the green color format: ductus reunions. Ductus reunions connect your cochlea to the saccules. Are you all clear? If you all are clear, so let me take you on the next, that is your endolymph. तो याद रखना, एंडोलिम्फ गाइस, एंडोलिम्फ में अंदर क्या होता है? केला, पोटेशियम ज्यादा होता है और सोडियम कम होता है. एंडोलिम्फ के अंदर व्हाट इज मोर? Potassium is more, sodium is less. Endolymph, what is more? Potassium is more and sodium is less. Sodium is less. Then coming to perilymph, it is just opposite to the endolymph. Now potassium is less and sodium is more. Simple. Now, who is secreting this endolymph? This is your exam question. This is none other than stria vascularis of the cochlea. Who is secreting, who is inner ear filled with endolymph, and endolymph is secreted by whom? Stria vascularis. And endolymph mein, what about the potassium? Potassium is more, sodium is less. Simple. Done, 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 done. Then coming to the cut section of cochlea. Then coming to the cut section of the cochlea. So guys, remember, cut section of the cochlea, remember like this. Remember like this. अपर इज वेस्टिबुलाई. अच्छा, टैम्पाने से याद कर लेते, स्काला टैम्पनाई. टी हमेशा नीचे होता है, टी है तो हमेशा नीचे होता है, ठीक है, बीच में मीडिया होता है और सबसे ऊपर क्या होती है? विक्ट्री. सबसे ऊपर क्या होती है? विक्ट्री. वेस्टिबुलाई, मीडिया एंड टैम्पनाई. Now, between your tympani and your media, what is present, sir? It is your basilar's membrane. It is your basilar's membrane. And what about the basilar's and what about the scala media and the vestibuli? It is your Reisner's membrane. It is your Reisner's membrane. Reisner's membrane. Now, on the basilar's membrane, there is a magic happening. What is present in the basilar membrane? It is your organ of Corti and tectorial membrane. It is your tectorial membrane. It is your tectorial membrane. So, sir, remember, scala vestibuli is at the top. Scala vestibuli is at the top, and then coming media, then coming the tympani. Between vestibuli and media, there is Reisner's membrane, and tympani and media, there is a basilar's membrane. Organ of Corti is present at basilar's membrane, and tectorial membrane is present on the basilar membrane. Done, 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 done. Then coming to the BPPV. Previous year question. BPPV. Guys, BPPV. What is BPPV? BP तो तुमने सुना है. PV. अब सुनो मेरे मुंह से. It is benign paroxysmal positional vertigo. Benign paroxysmal positional vertigo, and clinical condition is vertigo on changing the head position. As soon the patient is changing his or her head position, he is complaining or she is complaining of vertigo. As soon this kind of patient is coming to you after 4th of June, when you are in the hospital, you are taking the training, guys, remember, always make a diagnosis BPPV. Now diagnosis is very interesting. Diagnosis, D for diagnosis, D for Dix-Hallpike maneuver. क्या है? Dix-Hallpike maneuver. Diagnosis BPPV, Dix-Hallpike maneuver. और डिक्स कौन लेगा? आप ले. क्या बोलता है? आप ले. डिक्स कौन ले? आप ले. तो ट्रीटमेंट क्या है? एप्लेज मैन्यूवर. क्या है? एप्लेज मैन्यूवर. डायग्नोसिस में क्या है? डिक्स-Hallpike मैन्यूवर. और डिक्स कौन ले? आप ले. तो क्या बोलता है? एप्लेज मैन्यूवर. क्या बोलता है? एप्लेज मैन्यूवर. तो BPPV, vertigo on changing the head position. Vertigo on changing the head position is BPPV. At diagnosis is Dix-Hallpike maneuver, and the treatment is Apley's maneuver. Now, the function of semicircular canal. Now, the function of semicircular canal. Guys, remember, एंगुलर बैलेंस. सेमी सर्कुलर कैनाल क्या कराती है? जो तुमने ऐसे ऐसे करके देखी थी, वो क्या कराती है? एंगुलर बैलेंस. सेंसरी एंड ऑर्गन. Yes, sensory and organ. Who is sensory and organ? It is your crista. It is your crista. It is covered by gelatinous layer called as cupula. Crista is covered by cupula. So function of semicircular canal, angular balance. Then sensory and organ is crista, which is covered by gelatinous layer called cupula. अब आई बिल्ली की बार. बिल्ली कैसे करती है? और कुत्ता क्या बोलता है, आजा 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 आजा, है ना। तो बिल्ली बार क्या है, बिल्ली की बार, इट इज अ वर्टिकल बोनी सेप्टम इन द अपर पार्ट ऑफ इंटरनल ऑडिटरी कैनाल. Bony vertical septum present in the upper part of internal auditory canal would be your Bill's bar. What is your Bill's bar? Then Bira. Hi, Bira. Bira is very repeated question. Bira, guys, remember, it is your brain stem evoke response audiometry. Bira has 7 waves. Bira क्या है? Bira के पास क्या है? Bira is having 7 waves. Bira has 7 waves, and the most important wave of Bira would be your wave 5. Most important, this is repeated question of the exam PYQ. Remember, बीरा के पास कितनी वेव्स कितनी है? 7. बीरा के पास कितनी है? 7. कितनी है? 7. Then most important wave in Bera would be your 5. I know some guys taking this बेरा as a chilled बेरा which उसको पीने के बाद वो बेरा खोनी कहाँ चले जाते हैं, बेरा कैसी हरकतें करने लग जाते हैं. I know that बेरा very well, guys. With me, well-being neonates, जो बच्चे बिल्कुल ठीक होते हैं उनके अंदर तुम्हें अगर टेस्ट करना हो, यू विल गो फॉर OAE, यू विल गो फॉर OAE. अगर बच्चा बीमार हुआ उसको क्या पिला दो? बेरा. तो बच्चे सिक बेबीज के अंदर व्हाट यू हैव टू टेस्ट, यू हैव टू टेस्ट फॉर बेरा. यू विल यूज विच टेस्ट? बेरा. एंड इन वेल बेबीज यू विल यूज विच टेस्ट? यू विल यूज विच? OAE, ऑटो acoustic emission. Number 1 question clear. Most commonly used tuning fork would be your 512 hertz. Most commonly used tuning fork would be your 512 hertz. Done. Now coming to the Rene test and the Weber test. Rene test and the Weber test, sir. Sir, normally what is happening in the Rene, let me make it very simple for you guys. Normally what is happening, air conduction is more than bone conduction. This is very normal condition. Air conduction का ज़्यादा होना bone conduction से, it is very normal condition. Now what is happening in the conductive hearing loss? If you are performing a Rene test and you see conductive hearing loss, how you come to know? You will see bone conduction is more than air conduction. If in Rene test, close your eyes and listen to me. If in Rene test bone conduction is more than air conduction, then your diagnosis is conductive hearing loss. Done. Then coming to your sensorineural hearing loss, AC is more than BC. It is normally also present, but it is pseudo positive. This is known as pseudo positive because in normal people also it can happen. Air conduction can be more than bone conduction. But in sensorineural hearing loss also it can come same result, air conduction more than bone conduction. This is pseudo positive test of Rene. But if Rene is negative, that means bone conduction is more than air conduction, and your answer is conductive hearing loss. That means answer is conductive hearing loss. Now coming to the Weber test, which is very very simple. Weber test में क्या लिया? Tunic fork लिया, ऐसे हमारा center में रखा. If voice is heard in both the ears, that means is fine, that is normal ear. What if your voice is heard in the poor ear? What if your voice is heard in the poor ear? That will become your conductive hearing loss. That will become your conductive hearing loss. And what if heard in the better ear? If the voice is heard after putting tuning fork like this in the center, your voice is heard in the better ear, sir, your answer is sensorineural hearing loss. Your answer is sensorineural hearing loss. So Rene and Weber is clear to all of you. अगर पुअर ईयर में आवाज आती है वेबर में, कंडक्टिव हेयरिंग लॉस. अगर गुड ईयर में आती है मतलब सही है, सेंसोन्यूरल हेयरिंग लॉस. डन. क्लियर है जी सबको? नाउ up to 25 decibel, if you can hear, it is very normal. Up to 25 decibels, if you can hear, sir, it is very very normal. Now remember this normal graph. Let me show you a normal chart. BC and AC is less than 25. Right now I have told you AC and BC less than 25 should be normal. So that is why this graph is normal. This graph is very much normal. Next graph, what is happening? There is a more difference between the AC and BC. If this kind of graph is coming into the exam, that means this graph is showing you conductive hearing loss. This graph is showing you conductive hearing loss. AC more than B. AC and BC distance is very much, that is your conductive hearing loss. Now what is happening in the sensorineural hearing loss? In the sensorineural hearing loss, both AC and BC is more than 25. If both AC and BC is more than, namaste bhai, namaste from Nepal, hello ji. AC and BC, if it is more than 25, this is sensorineural hearing loss. If AC BC distance is more, that will become your conductive hearing loss. And if both AC and BC is less than 25, that means this is very normal ear. That is very normal ear, sir. Now tympanometry, it is also known as impedance audiometry. Up, I'll make it simple for you guys. How? Let me show you. Type A curve means curve is very much A class curve is there and curve is very much normal like this. टाइप बी इट इज ग्लू ईयर, भरा हुआ है. अब इस चीज पे भरा हुआ पानी डाल दो तो क्या हो जाएगा? फ्लैट कर्व. तो भरा हुआ मतलब ग्लू ईयर में द कर्व विल कम फ्लैट. It type A curve will be normal and C type C curve is seen in Eustachian tube dysfunction. Type C curve is seen in Eustachian tube dysfunction. Eustachian tube dysfunction. And A as for otosclerosis. A S for otosclerosis and AD is for ossicular dislocation. D is for ossicular dislocation. दोस्तों दोबारा से, A curve नॉर्मल, B मतलब भरा हुआ ब्लू ईयर, C मतलब Eustachian tube dysfunction, AS otosclerosis and AD is ossicular dislocation. AD is ossicular dislocation. Now coming to the presbycusis. What is presbycusis? It is age-related hearing loss. Presbycusis is age-related hearing loss. Presbycusis is age-related hearing loss. Presbycusis, let me compare it with the Meniere's disease. Presbycusis, let me compare it with the Meniere disease. Presbycusis, guys, remember, and Meniere disease, both of them are showing what? Sensorineural hearing loss. Both of them are showing what? Sensorineural hearing loss. Presbycusis, bilateral. Presbycusis is bilateral. Presbycusis is bilateral. And the Meniere's disease is your unilateral. Meniere's disease, remember, a mean people always would think unilaterally, think about themselves. They'll not think about others. That is why Meniere's, it is unilateral, and presbycusis, it is bilateral sensorineural hearing loss. Done. Then coming, guys, giving sloping audiogram. प्रेस्बाइकोसिस विच इज सीन इन द ओल्ड एज, और ढलती उम्र में भी ढलता हुआ ऑडियोग्राम आएगा, तो स्लोपिंग ऑडियोग्राम क्या आएगा? स्लोपिंग ऑडियोग्राम. और मीनियस पीपल आर वेरी मच यूनिलेटरल, दे आर वेरी मच मीन पीपल, सो दे वांट देमसेल्फ टू ग्रो. दैट इज व्हाई राइजिंग ऑडियोग्राम इज सीन इन मीनियस डिजीज. मीनियस डिजीज इज आल्सो नोन एज ईयर ग्लूकोमा, एंडोलिम्फेटिक हाइड्रोप्स, ईयर ग्लूकोमा. ठीक है जी. चल, hearing loss in otosclerosis. Let's talk about the otosclerosis, sir. It causes conductive hearing loss, and most common question which is asked in the otosclerosis is your dip at 2000 hertz in BC. In bone conduction, there is a dip on 2000 hertz, and this will form a notch that is known as Cahardt's notch. That is known as Cahardt's notch. That is known as Cahardt's notch. Maximum मतलब most common present in young female. Guys, remember, otosclerosis most commonly seen in young female, क्योंकि फीमेल को ज्यादातर क्या पसंद है? ऑटो पे ट्रेवल करना है, चारों तरफ से हवाएं आती है, जुल्फे लहराती रहती है, तो क्या है? ऑटोस्क्लेरोसिस, यंग फीमेल. और अगर प्रेगनेंसी हो जाए तो सोने पे सुहागा. प्रेगनेंसी एग्रीवेट्स. प्रेगनेंसी क्या करती है? एग्रीवेट करती है, उसको और बढ़ावा देती है. नाउ व्हाट इज हैपनिंग? हाउ यू विल कम टू नो? फीमेल थी, यंग थी, प्रेग्नेंट थी, उसके बाद पेशेंट कहती है पेशेंट हियर बेटर इन द नॉइजी एरिया. डॉक्टर साहब, मुझे शोर वाली जगह पे ज्यादा सुनाई देता है. तो मैंने कहा ये तो नॉर्मल बात है, लड़कियां तो क्लब में भी बात कर लेती है, म्यूजिक के सामने बात कर लेती है. नहीं डॉक्टर साहब, देखो मैं प्रेग्नेंट भी हूँ, और देखो मैं हसीन भी हूँ. देखो मैं डॉक्टर साहब क्या हूँ? हसीन भी हूँ. तो मैंने कहा नहीं, अब तो कोई दिक्कत है, तुम हसीन भी हो, प्रेग्नेंट भी हो, तुम्हें नॉइस में भी सुनाई दे रहा है. इतनी सारी बातें एक साथ नहीं हो सकती. सो आई कंक्लूडेड दैट दिस इज पैराकोसिस विल्सी. दिस इज पैराकोसिस विल्सी. एंड देन आई चेक शॉर्ट साइन. Guys, a female was short sign positive, and there was flamingo pink appearance behind the tympanic membrane. Then I said, oh my god, this is a case of otosclerosis. This is a case of otosclerosis, and the treatment of choice would be surgery, stapedotomy. treatment of choice in surgery would be stapedotomy, and the treatment of choice for the person who is short sign positive. Guys, this is very tricky situation. If examiner in the case of otosclerosis is not at all mentioning the short sign, then sir, your treatment would be stapedotomy. And if examiner is showing that short sign is positive, then your treatment will change to sodium fluoride. So never ever make your mistakes in the exam. Sodium fluoride is only given when short sign is positive. And surgical management stapedotomy. Surgical management is stapedotomy. देखो मैं तुम्हें पूरी रात गाने भी सुनाते रहूं, इट मैटर कि तुम बैठोगे कि नहीं बैठोगे। ये कम से कम भी 4 घंटे लगेंगे। पूरे ईएनटी इतना बड़ा सब्जेक्ट है और मैं इसको बड़ी स्पीड में करना चाहता हूँ। फिर तुम 10 बजे के बाद प्रोन पोजीशन में सोने चले जाओगे, फिर मैं अकेला किसको पढ़ाऊंगा? हैं बताओ, गाने सुनने की क्या करना है? तो गाइन वंडरहॉफ सिंड्रोम क्या है? वंडरहॉफ सिंड्रोम। वंडरहॉफ सिंड्रोम देखो 10 दिन रह गए हैं, मेरे पास तो बहुत टाइम है, मेरे पास बहुत टाइम है, ठीक है। तुम्हारे 10 दिन रह गए, अब सोच लो तुम, है ना। उसमें भी मैं अपने काम धंधे छोड़ के यूट्यूब सेशन लेता हूँ तो लोग गालियां देने लग जाते हैं, बताओ, है ना। तो गलत बात है यार, बड़ी गलत बात है ना। एक तो भलाई करो, दूसरा गाली भी सुनो। सुन लेंगे, कोई दिक्कत नहीं, दुआएं भी तो मिल ही रही है ना। ऑस्टियोजेनेसिस इम्परफेक्टा, ऑटोस्क्लेरोसिस एंड ब्लू स्क्लेरा। तो निमोनिक क्या? बू। निमोनिक क्या? बू बू बू। ब्लू स्क्लेरा, ऑटोस्क्लेरोसिस एंड ऑस्टियोजेनेसिस इम्परफेक्टा, ठीक है। सो गाइस, ब्लू स्क्लेरा, ऑटो क्या कह रहे हो? हाल क्या है दिलों का न पूछो सनम, आपका मुस्कुराना गजब ढा गया। हाल क्या है दिलों का न पूछो सनम, आपका मुस्कुराना गजब ढा गया। दोस्तों अभी 10 दिन बाद एग्जाम है, अगर मैं आपको सब चीज बताने लगा ना कि ये क्या है, ये क्या है, ये क्या है, मतलब फिर मैं ईएनटी की फैकल्टी बन गया हूं, मैं सारी चीजें समझा रहा हूं। अभी 4 घंटे में वो सब्जेक्ट कंप्लीट करना है जिसको पढ़ाने में 40 घंटे लगते हैं और जिसको कॉलेज में 1 साल लगता है पढ़ाने में। समझ रहे हो बात को? देयर इज अ लिमिटेशन टू एवरीथिंग। 10 दिन पहले पूछ रहे शॉर्ट साइन क्या है, तो आई डोंट थिंक दिस इज अ फेयर क्वेश्चन एंड आई शुड एंटरटेन इट एट दिस पॉइंट, है ना। तो acoustic neuroma, और इट इज ऑल्सो नोन एज वेस्टिबुलर schwannoma। acoustic neuroma इज ऑल्सो नोन एज, ठीक है। तो दोस्तों ठोकर खाकर गिरना, फिर खुद को खुद ही संभाल फिरना। ठोकर खाकर गिरना, फिर खुद को खुद ही संभाल फिरना, दोबारा से चलना, यही संघर्ष है, यही जीवन का सत्य है। ठोकर खा के गिरो और फिर उठो और फिर चलो और फिर करके दिखाओ। आई विल पास, आई विल पास, आई विल पास, आई विल पास। डन डना डन डना डन डना डन, ठीक है। चलो, being tumor of benign tumor of 8th acoustic neuroma or vestibular schwannoma is a benign tumor of 8th nerve. It is a benign tumor of 8th nerve. Now clinical condition, it is unilaterally progressive sensorineural hearing loss. तो तुम्हारा acoustic neuroma, which is also known as vestibular schwannoma, it is a benign tumor of 8th nerve and there is a sensorineural hearing loss. And which type? Bilateral or unilateral? Sir, your answer is unilateral. Then coming tinnitus. What is tinnitus? Tinnitus is ringing sensation in the ear. Tinnitus is a ringing sensation in the ear. So guys remember, and also there is an imbalance. So acoustic neuroma is basically a tumor of benign tumor of 8th nerve, and there is a sensorineural hearing loss. There is a tinnitus, and what is present there? Rollover phenomena is present in the vestibular schwannoma. Now investigation of choice, if I ask you, your answer is gadolinium enhanced MRI. Investigation of choice would be gadolinium enhanced MRI and the treatment would be surgery. Now coming to the glomus jugulare. ग्लोमस जुगुलारे मतलब ग्लो हो रहा है, कुछ ग्लो हो रहा है, तो क्या ग्लो हो रहा है? बल्ब हो रहा है, बल्ब ग्लो होता है। सो लोकेशन इज जुगुलर बल्ब, लोकेशन इज जुगुलर बल्ब, लोकेशन इज जुगुलर बल्ब। इट इज हाईली वास्कुलर ट्यूमर। Guys, remember, in the highly vascular tumor, biopsy is always contraindicated. Your biopsy is always contraindicated. That is why, remember, glomus jugulare, location is jugular bulb. Location is jugular bulb. अब जब जगमगाता है, सूरज भी जगमगाता है। सुबह सुबह क्या जगाता है? सूरज भी क्या करता है? जगमगाता है। तो राइजिंग सनसाइन, और उगता हुआ सूरज थोड़ा थोड़ा ब्राउन होता है। यस, दैट इज व्हाई ब्राउन साइन। सो राइजिंग सनसाइन एंड ब्राउन साइन इज सीन वेयर, सर? इट इज योर ग्लोमस जुगुलारे. It is your glomus jugular. और ग्लो कौन करती है? फीमेल करती है, ऑलवेज ग्लो करती रहती, क्यूटी क्यूटी दिखती रहती है. सो क्लिनिकल प्रेजेंटेशन विल बी फीमेल पेशेंट विद द पल्सatile tinnitus एंड द ब्लीडिंग ईयर मास. सर योर आंसर इज ग्लोमस जुगुलारे. और यहां से भी चैन नहीं पड़ा तो सीटी स्कैन कराएंगे. फेल्प साइन इज थिन. तो फेल्प साइन हाउ यू हैव टू रिमेंबर, ग्लो करता है बल्ब किसका? फिलिप्स का बल्ब. किसका बल्ब? फिलिप्स का बल्ब. सो गाइस रिमेंबर फिलिप्स का बल्ब. ठीक है, 4 जून तक रिमेंबर करो कि ब्राउन कलर का भी उगता हुआ सूरज होता है. ठीक है भाई, फीलिंग को समझा करो, इंटेंशन खराब नहीं है. सूरज का रंग ब्राउन भी होता है. आज के बाद गाना है ना, ब्राउन मुंडे ऐसे ही ब्राउन सूरज. कैसा सूरज दिखा? ब्राउन. तो 4 तारीख तक ब्राउन सूरज देखना सुबह सुबह, ब्राउन साइन और राइजिंग सन साइन. डन डना डन. और बल्ब जगता है कौन सा? फिलिप का बल्ब. तो सीटी स्कैन में क्या देखने मिलेगा? फेल्प साइन. क्या देखने मिलेगा? फेल्प साइन. ठीक है, और सिग्मोइड साइनस थ्रोम्बोसिस के अंदर क्या देखने मिलेगा? लैटरल साइनस और सिग्मोइड साइनस थ्रोम्बोसिस के अंदर कौन सा साइन था सीटी में? डेल्टा साइन. यहां पे ग्लोमस जुगुलारे में क्या देखने मिल रहा है? फेल्प साइन. क्या देखने मिल रहा है? फेल्प साइन. डन डना डन डना डन डना डन. ट्रीटमेंट इज सर्जरी. Now, sir, coming to the Meniere's disease. Sir, now coming to the Meniere's disease. Meniere's disease, as I already told you, it is ears glaucoma. Meniere's disease is ears glaucoma, and you remember sensorineural hearing loss is seen. And कैसा वाला? Unilateral. और इसमें कर्व कैसा था? Rising audiogram. कैसा था? Rising audiogram. Let's study in the deep. Meniere's disease is endolymphatic hydrops, which is ear glaucoma. Clinical feature would be your tinnitus, vertigo and hearing loss. Tinnitus, vertigo and hearing loss. Hearing loss. ठीक है जी. Tumarkin's crisis. Number 1 is Tumarkin crisis in your Meniere's disease. What is Tumarkin crisis? Some patients during the episode falls down without turning unconscious. Some patient during the episode falls down without turning unconsciousness. This phenomena is known as Tumarkin crisis. जैसे किसी को मारते हो, Tumarkin, थप्पड़ मारा, नीचे गिरा पर बेहोश नहीं हुआ. This is known as Tumarkin crisis. This is known as Tumarkin crisis. Then coming to the recruitment phenomena. Recruitment phenomena means a patient hears loud sound more loud. तुमने बोला I will pass, उसको इतनी जोर से सुना दिया I will pass, I will pass, I will pass. तो ये क्या है? Recruitment phenomena. This phenomena is known as recruitment phenomena. Tullio phenomena क्या है? Tullio phenomena. अब दो दोस्त थाईलैंड गए तो दोनों में लड़ाई लगी हुई है, तू ले तू ले तू ले, है ना. तो इतने में एक दोस्त बोलता है दूसरे वाले को, क्या बोलता है? तू ले. क्या बोलता है? तू ले. और ऐसा सुनते ही दूसरे वाले को चक्कर आ गए. तो पेशेंट गेट वर्टिगो ऑन हियरिंग द लाउड साउंड. दिस इज नोन एज Tullio's phenomena. This is known as what? Tullio's phenomena. Then coming to the diplacosis. Patient hears same sound in 2 frequencies. मैंने बोला I will pass, सुना I will pass, I will pass. मैंने बोला I love you, 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 I love you. मैंने बोला ट्रक भर के तो ट्रक भर के ट्रक भर के ट्रक भर के ट्रक भर के ट्रक भर के. Diplacosis. This is known as diplacosis. Now investigation is electrocochleograph. The investigation is very simple. That is electrocochleograph. And medical management के बात करनी है surgical management. और surgical management के लिए there is a landmark required for the endolymphatic sac decompression surgery, and that landmark is your Dolandson's line. Dolandson's line. It is a surgical landmark for the endolymphatic sac decompression surgery, sir. And if it is not resolving, तुमको कान मारना है. क्या करना है? कान मारना है. कान मारना है, वो नहीं जो तुम सोच रहे हो. कान मारना है, कैसे मारोगे? By injecting gentamicin. Transtympanic injection of the gentamicin, sir. Sir, coming next, device of hearing. Next coming to the device of hearing. सबसे पहले क्या है? hearing aid के अंदर क्या दोगे? It is a sound amplifier, but it is indicated only in less than 90 decibel hearing loss. This sound amplifier is only indicated in the hearing loss less than 90 decibel. It is not indicated in the profound hearing loss, which is more than 90 decibel. More than 90 decibels, it is never indicated, but less than 90 decibels, it is indicated. It is indicated. Classification of hearing loss. Mild 26 to 40. Mild it is 26 to 40. Moderate 41 to 55. Moderately severe 56 to 70, severe 71 to 90, and profound more than 90. So you will not give a sound amplifier in this condition. So guys, remember what you have to give. You have to go for the cochlear implant. if there is a bilateral profound sensorineural hearing loss, that means I'm talking about the hearing loss more than 90 decibels, then you will go for the cochlear implant. And for cochlear implant, your prerequisite is very important, that is normal eighth nerve. That means your eighth nerve should be normal, because cochlear implant stimulate the eighth nerve and it helps in the hearing. It helps in the hearing. So this is an image of your cochlear implant. This is an image based question of your cochlear implant. It is actually stimulating your eighth nerve. Actually stimulating your eighth nerve. Now what, sir, if your eighth nerve is not fine? What you will do if your eighth nerve is not fine? पहले ये बताओ, ये मेरी क्लास चल रही है कि ऑर्केस्ट्रा का शो चल रहा है, कि कॉमेडी नाइट चल रही है, कि यहाँ मैं घुंघरू पहन के नाचना भी शुरू कर दूं पढ़ाते पढ़ाते, कोर्स भी पूरा कंप्लीट करूं? फिर मेरे को कल कितने लोगों ने सुनाया, आपने हिंदी में पढ़ा, मेरे को कितना बुरा लगा है, कितने लोगों ने मुझे पर्सनल मैसेज करे, यूट्यूब पे गंदा गंदा लिखा, मेरे को कितना बुरा लगा वो तो दोस्तों, ऑडिटरी ब्रेन स्टेम इम्प्लांट, ऑडिटरी ब्रेन स्टेम इम्प्लांट, रिमेंबर इंडिकेशन इज न्यूरोफाइब्रोमा टाइप 2, where is bilateral acoustic neuroma, eighth nerve tumor. Bilateral acoustic neuroma, eighth nerve tumor is there. If eighth nerve is not fine, you will go for the auditory brain stem implant. It is your auditory brain stem implant. This is brain stem implant. This is your brain stem implant. तो दोस्तों, मजे मजे में ear is over. Ear is over. Just give me thumbs up if you got it. ठीक है? तो ear is over. Ear approximately cover the 40% of the ENT. So in the first hour we have completed the ear. Yes, कान complete हो गया. कान complete होने की खुशी में दोस्तों के लिए एक प्यारी सी बात, किताबों की अहमियत अपनी जगह है जनाब। कहते हैं किताबों की अहमियत अपनी जगह है जनाब। सबक वही याद रहता है, सबक जिंदगी में वही याद रहता है जो वक्त और लोग सिखाते हैं। सबक वही याद रहता है जो वक्त और लोग सिखाते हैं। तो गाइस, in between this I want to tell you, if any time you are feeling low, you want to talk, you want to share something, you all can connect me on Instagram as pjamwal7. I would love to see you guys there with me, and I'll be motivating you there, because maximum time I'll reply there also, there only. ठीक है, चलो। So with this, let's start our next topic, that is your beautiful nose. Noji, 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 koji, koji, noji. Yes, koji, koji, noji. So girls, boys, how's the makeup I have done for this beautiful lady? Aha, आंखें तेरी कितनी हंसी, करती है जादू, मैं हूं बेकाबू, गौतम नगर में इश्क है, पता नहीं। चलो, नेजल बोन, ये जो कलर है ना, जिसका नाम मुझे नहीं पता ये कौन सा कलर होता है, मेरे लिए तो ये व्हाइट सा कलर है गाइस। रिमेंबर, दिस इज व्हाइट कलर, दिस इज नेजल बोन, दिस इज नोन एज नेजल बोन, दिस इज नोन एज नेजल बोन। ठीक है, और गायत्री माता आ चुकी हैं। गायत्री माता के नाम पे मैं एक गायत्री मंत्र सुनाना चाहूंगा। ओ भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। ये डॉक्टर गायत्री जब हॉस्पिटल में जाएंगी तो इनको कैसे बुलाया जाएगा? ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। प्लीज कम, पुट कैनुला हियर, प्लीज कम हियर। यस गाइस, नेक्स्ट इज योर ब्यूटीफुल लेडी, which might be girlfriend of one of your friends. ठीक है, so remember nasal bone, then coming to the center part which is your septal cartilage and upper lateral cartilage, then coming to your alar cartilage. Sir, alar cartilage, they form the external nasal opening. Alar cartilage is forming the external nasal opening, external nasal opening. Done dana done. ठीक है, टेली महात क्या कहती हैं? Why are you singing dog? तो डॉग को किसी ने बेड़ियां पहना रखी हैं कि मैं अपनी मर्जी से कुछ नहीं कर सकता। नहीं, मतलब मैं कुछ करूं, मेरे को किसी को जवाब देना पड़ेगा क्या? इट्स माई लाइफ, फ्री मैन हूं, प्रिजन में नहीं हूं। आई एम नॉट इन प्रिजन मैन, आई कैन डू एनीथिंग आई वांट। मेरे को जो अच्छा लगेगा, मेरे को दिन में अच्छा लगेगा मैं दिन में करूंगा, मेरे को रात में अच्छा लगेगा मैं रात में करूंगा। ये मेरी मर्जी, मैं चाहे ये करूं, मैं चाहे वो करूं, मेरी मर्जी। यस यस यस। कॉटलेस टेस्ट ऐसे करके, कॉटलेस टेस्ट क्या है, कॉटलेस टेस्ट ऐसे करके करते हैं. इट इज डन टू चेक द ब्लॉकेज ऑफ नेजल वेल्व. इट इज डन टू चेक द ब्लॉकेज ऑफ नेजल वेल्व. इट इज नेजल वेल्व. अगर मैं लोगों की सुनूं तो मैं चैंटिंग भी ना कराऊं. सोचो, करा रहा हूं, मेरे को भी तो मजे आने चाहिए. इट इज हार्ड टू सिट अलोन एंड डू दिस स्टफ टू मेक इट इंटरेस्टिंग. इट इज वेरी हार्ड. आई एम टेकिंग क्लास फ्रॉम 10 AM इन द मॉर्निंग. Since 10 AM I'm doing chanting continuously. So मेरे को भी हक बनता है ना गाते हुए, हंसते हुए, नाचते हुए तुम्हारी क्लास लेने का, ताकि तुम्हें भी मजा आए, मुझे भी मजा आए. वरना इस शक्ल, ऐसी बुरी शक्ल को क्यों देखोगे तुम लोग? कैसी बात करते हो, अच्छा मजाक करते हो है. चलो, कॉटलेस टेस्ट. इट इज डन टू चेक द ब्लॉकेज ऑफ नेजल वेल्व. ठीक है, चलो जी. सैडल नोज. लेट्स टॉक अबाउट द सैडल नोज. सैडल नोज से क्या याद रखना? लकड़ी की काठी, काठी पे घोड़ा, घोड़े की दुम पे जो मारा हथौड़ा, घोड़ा 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 धूप उठा के दौड़ा. सैडल नोज कैसा है? सैडल नोज क्या है? सैडल नोज. सो गाइस रिमेंबर, मोस्ट कॉमन कॉजेस ट्रॉमा. मोस्ट कॉमन कॉजेस ट्रॉमा. Other causes can be leprosis, syphilis, septal surgery. Leprosis, syphilis, and septal surgery. This is saddle nose. This is your saddle nose. This is your saddle nose. And treatment is augmentation rhinoplasty by using graft from iliac crest. नीचे से ग्राफ लेना है. कहां से? यहां से. iliac crest कहां होता है? Imagine that sexy part of your body. So guys remember, saddle nose, most common cause is trauma, and the other cause would be leprosis, syphilis, septal surgery. Treatment would be augmentation rhinoplasty. Augmentation rhinoplasty. ठीक है जी, चलो जी. Most common malignancy of the external nail. External nose की most common malignancy, recently NEET PG exam question would be your basal cell carcinoma or the rodent ulcer. This is a image based question of basal cell carcinoma or basal cell carcinoma is, ठीक है. मेरी आईज कैसी होती जा रही है? ब्लू आईज हिप्नोटाइज मेरी कर दी ए तेनू, तू पढ़ ले अच्छे से और दिल खुश कर दे मेरा. ठीक है, ये कोका नहीं है, कान नाक में डालो. दिस इज बेसल सेल कार्सिनोमा. ठीक है, चलो दोस्तों. पोटैटो नोज. तो आप सबने डिनर में पोटैटो तो खाए होंगे जब बन रहे होंगे. तो दोस्तों, राइनोफाइमा. इट इज हाइपरट्रॉफी ऑफ द सेबेशियस ग्लैंड. हाइपरट्रॉफी ऑफ द सेबेशियस ग्लैंड. और ये रहा क्या, अंकल की नाक पे क्या लगा होगा? ताजा ताजा आलू. क्या लगा है? ताजा ताजा आलू. आलू आलू, ताजा ताजा आलू. दिस इज योर ताजा ताजा आलू. दिस इज ताजा ताजा आलू. ठीक है जी, चलो. सो गाइस रिमेंबर, what is the treatment of potato nose or rhinophyma? It is your CO2 laser excision plus skin grafting. CO2 laser excision plus skin grafting is our treatment. Now coming to the rhinolith. Rhino means nose and lith मैंने stone. Lith मैंने stone. Formation of stone in the nasal cavity. तो क्या बोला? पत्थर के सनम तुझको हमने मोहब्बत का खुदा माना, बड़ी भूल हुई आज हमसे, ये क्या समझा ये क्या जाना, पत्थर के सनम. राइनोलिथ. तो अगर नाक में आ जाता है तुम्हारे पत्थर, तो देयर इज अ नेजल पेन, देयर इज अ नेजल ब्लॉकेज, एंड बिकॉज ऑफ ब्लॉकेज देयर विल बी फाउल स्मेल. And also there can be a epistaxis cell. Now how you have to remove this stone? You have to remove this stone with the help of endoscope. With the help of endoscope. ठीक है, चलो endoscope, and this is endoscopic removal. Now coming to the nasal myiasis. Nasal myiasis sir. So guys remember, पत्थर के सनम. अच्छा, इसकी ट्रांसलेशन. ओके, सो गाइस सर रिमेंबर, पत्थर के सनम तुझको हमने मोहब्बत का खुदा माना. A stone-hearted woman, my love, a stone-hearted woman, my love, I have taken you as a father of love or a mother of love. मोहब्बत का खुदा माना. A goddess or a god of love. I have taken you as a god or goddess of love. Done. Nasal myiasis cryosomia. Nasal meiosis, it is your cryosomia, presence of maggots in the nose. It is presence of maggots in the nose. And remember, what is the treatment? A treatment would be maggot oil. A treatment would be maggot oil. अब ये maggot oil बना कैसे? कैसे बना? कैसे बना? ये कैसे बना? इसमें डाला क्लोरोफॉर्म और क्या बना? टर्पेंटाइन ऑयल. क्लोरोफॉर्म एंड टर्पेंटाइन ऑयल. क्लोरोफॉर्म एंड टर्पेंटाइल. टर्पेंटाइल, टर्पेंटाइल, टर्पेंटाइल. ठीक है? हाँ, क्यूट हूं ना मैं. ये देखो गाल की चॉइस करके. सर यू आर क्यूट. लू 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 लू. कर मत देना. चलो. Nasal meiosis, cryosomia, presence of maggots in the nose. Maggot oil is chloroform plus turpentine oil. ठीक है? Nasal bone. Nasal bone fracture. Let me talk about the nasal bone fracture, sir. The first most common fracture bone of the face would be your nasal bone. Would be your nasal bone. Would be your nasal bone. ठीक है जी? उसके बाद treatment, immediate close reduction before the edema start. एडिमा स्टार्ट हो गया तो भाई फिर दिक्कत हो जाएगी. ठीक है? immediately you have to do the close reduction if there is a nasal bone fracture. So guys, using MCQ forceps, and the name of forceps is Walsham forceps, and the name of forceps would be your Walsham forceps. So nasal bone fracture में which forceps is used, sir? Your answer is Walsham forceps. Nasal septum fracture. Now it is nasal septum fracture. Nasal septum fracture दो तरीके से देखो. One force is coming from the front. One force is coming from the front and another is coming from the below. One is coming from the front and another is coming from the below. Front wala is something horizontal, or it is also known as Jarge wave fracture. Pre-YQ. Front force is known as horizontal force, or it is also known as Jarge wave. The force which is coming from down below, it is known as vertical or Chevrolet fracture. Vertical or Chevrolet fracture, sir. Now the treatment is fracture reduction by using the Ash forceps. क्या बोलते हैं? Ash कर. क्या बोलते हैं? Ash कर, Ash कर, Ash कर. जिंदगी के सारे मजे कैश कर, कैश कर, कैश कर. Nasal septum fracture, if the force is coming from front, it is known as horizontal fracture or Jarge wave fracture. If the force is coming from below, it is known as vertical or Chevrolet fracture. We are using Ash forceps here, and if there is a fracture of nasal bone, then we are using Walsham forceps. Now, mid-face fracture, there is very famous classification known as Lee-40 classification. It is known as Lee-40 classification. Lee-Ford 1, it transverse fracture. Lee-Ford 1, it is transverse fracture. Lee-Ford 2, it is pyramidal fracture. Lee-Ford 2, it is pyramidal fracture. Lee-Ford 3 would be your craniofacial disjunction. Guys, remember, in Lee-Ford 1, which is your transverse fracture, there is a no CSF leak. There is a no CSF leak. And Lee-Ford 2 and Lee-Ford 3, which is pyramidal and craniofacial disjunction, there can have a CSF leak. They can have CSF leak. So Lee-Ford 1, no CSF leak. Lee-Ford 2 and 3 can have CSF leak. Can have CS leak. Chalo. Next is Kuanka. Next is your Kuanka. So guys, remember, concha is like concrete. Concrete means hard. So what is hard? Your bone is hard, sir. It is a bony part of the turbinate. It is a bony part of the turbinate. Now it's coming to कोना. कोना, पिछला कोना. तो क्या बोलता है? कोने में चलो. क्या बोलते हैं? कोने में आ जाओ, मोहब्बत करेंगे. खुल्ले में खुल्ले नहीं करेंगे. है कि नहीं? कोना क्या है? कोना मतलब कोना. कोना मतलब कोना, posterior opening of the nasal cavity. The posterior opening of the nasal cavity is known as coana, and the bony part of the turbinate is known as concha. It is known as concha. It is known as concha. Then coming to the paranasal sinus. So before studying about the paranasal sinus, let's have a drink of water. So all of my friends on boards with me. So paranasal sinus, guys, remember what is the beauty of paranasal sinus? All of the organs in the body, they are ventilated during the inspiration. All of the organs in the body, they are ventilated during the inspiration, but paranasal sinus, they are ventilated during the expiration. They are ventilated during the expiration. Now, 4 paranasal sinuses, I'll make you very perfect with them. Please be with me, listen to me, be very, very carefully. सबसे पहले maxillary sinus I'm going to talk about. Maxillary sinus, remember ma. Maxillary sinus, remember ma. Ma is the largest sinus volume. So maxillary sinus is our largest sinus volume 15 ml. और माँ सबसे पहले जिंदगी में आई, माँ सबसे पहले जिंदगी में कौन आता है? माँ आती है. इसलिए वी आर वेरी थैंकफुल टू आवर मदर्स हु आर फीडिंग अस डे एंड नाइट, irrespective what we are doing in our life, in our all hard time and good time. The only support we got is mother. Primary is mother, then father is always there, but primary support, emotional support, always mothers are providing us. So we thankful to your mothers, and write in the chat box right now, I love my mom, I love my mom. So along with this, first sinus to appear in the human would be your maxillary sinus. Done. Then frontal sinus. Let's talk about the frontal sinus, sir. So frontal sinus, remember, it is the last sinus. कैसे याद करोगे? फ्रंट फुट पे आके क्या मारना है? छक्का मारना है. फ्रंट फुट पे आके क्या मारना है? छक्का मारना है, और लास्ट बॉल पे मारना है. और कब मारना है? लास्ट बॉल पे. सो रिमेंबर, यू हैव टू हिट अ 6 एट द लास्ट बॉल. सो इट इज अ लास्ट साइनस टू स्टार्ट डेवलपिंग इन द ह्यूमन. इट इज अ लास्ट साइनस टू स्टार्ट डेवलपिंग इन द ह्यूमन. एंड फर्स्ट रेडियोलॉजिकल एविडेंस, छक्का मारना था ना, 6 years of age. It is your 6 years of age. It is your 6 years of age. Frontal sinus, last sinus to start developing in the human, and the first radiological evidence would be 6 years of age. 6 years of age. ठीक है? Sphenoid sinus. Sphenoid sinus. Radiological evidence seen at 4 years of age. Radiological evidence is seen in 4 years of age. Remember one thing. After 4th of June, when you're going to pass, you'll earn money. From that money, one day you will ask your parents, मम्मी पापा चलो आज let's go for shopping. Take them to any gold shop और ऐसे बोलो, मम्मी कितना भी महंगा हो खरीद लो, आज पैसे मैं दूंगा. वो जो दिन और वो जो फील होगी ना लाइफ की, उससे बड़ा गिफ्ट कुछ नहीं हो सकता, और उससे बड़ी सेटिस्फेक्शन तुम्हारे अंदर कुछ नहीं हो सकती. वो दिन को लाने के लिए ना दिन रात जगना पड़ेगा, मेहनत करनी पड़ेगी. और अगर दिन रात मेहनत कर दी ना, तो एक दिन वो आएगा, ऐसे बोलोगे, मम्मी पापा आओ आज क्या खरीदोगे ये बताओ, आज मेरा कार्ड काम करेगा और आप खरीद के जाओगे. मतलब वो तोहफा, मतलब उस दिन मम्मी पापा विल बी लाइक अ प्राउडेस्ट पेरेंट इन द वर्ल्ड. वो गूस बम्स आ जाएंगे. वो सोच के देखो, गाड़ी लेके जा रहे हो और मम्मी आज मैं शॉपिंग कराऊंगा, आज मैं पैसे खर्च करूंगा. ठीक है? तो गाइस इसी फील के साथ काम करोगे ना, स्टे मोटिवेटेड यार. अच्छे दिन आ रहे हैं और तुम ला रहे हो, मेहनत से ला रहे हो. ठीक है? लव यू ऑल यार. Sphenoid sinus, guys, remember sphenoid sinus radiological evidence is seen at 4 years of age, and now it is coming for the ethmoid sinus. It is coming at 2 years. First radiological evidence is seen at 2 years. Ethmoid sinus, remember, ethmoid air cells are present. Now ethmoid sinus is divided into two: bulla ethmoidalis and agar nesi. Bulla ethmoidalis, bulla जो रखता है सारी चीजें खुला खुला, बुल्ला जो रखता है सारी चीजें खुला खुला. It is a most constant and largest anterior ethmoid air cell. Sir, who is the most constant and the largest anterior ethmoid air cell? Your answer is bulla ethmoidalis. Your answer is bulla ethmoidalis. Agar nesi, anterior most anterior ethmoid air cell. Agar nesi, anterior most anterior ethmoid air cell. Anterior most anterior ethmoid air cell. It is agar nesi. Most constant largest anterior ethmoid air cell. Sir, your answer is bulla ethmoidalis. Your answer is bulla ethmoidalis. Now, these ethmoid air cells can grow into 3 unusual locations. These ethmoid air cells can grow into 3 unusual locations. And what are those locations, sir? Number 1 is your orbital floor. If they are present at your orbital floor, this is known as Heller cell. They are known as Heller cell. Now, if they are close to the optic nerve, this is known as Onodi cell. And if they are inside the middle turbinate, this is known as concha bullosa. Along with me. Orbital floor पे अगर तुम्हारे ethmoid air cells are present, this is known as Heller cell. This is known as Heller cell. If they are close to the optic nerve, they are known as Onodi cell. If they are inside the medial turbinate, they are known as concha bullosa. They are known as concha bullosa. Then coming to the middle meatus. The next topic is middle meatus. So the middle meatus mnemonic is BUI. बुई, you know milk, बुई is known as milk in Delhi and all north, बुई is known as milk, बुई पिएगा, क्या बोलते हैं, बुई पिएगा. So guys, middle meatus के 3 लैंडमार्क है, बुल्ला एथमोडालिस, uncinate process and ethmoid infundibulum. And these all three, buoy is making which complex? Osteometal complex. Your buoy is making what? Osteometal complex. And if your osteometal complex is blocked, sir, it will lead to sinusitis. So how sinusitis is happening? It is due to blockage of osteometal complex, and this osteometal complex is made by your buoy. It is made by what? Buoy. Yes. Then coming to the sinusitis. That's coming to the sinusitis. So guys, remember investigation. If I ask best investigation, sir, your answer is a nasal endoscopy. Best investigation would be your nasal endoscopy, and your best radiological investigation for the sinuses would be a CT scan. Best radiological investigation, if they ask specifically, your answer is CT scan. Normally best investigation nasal endoscopy, okay? But one view is used, that is known as Waters view. Now sir, Waters view is showing all the sinuses except your one sinus, and that is your posterior ethmoidal sinus. Water view shows all the sinus except your posterior ethmoid sinus, except your posterior ethmoid sinus, posterior ethmoid sinus. Now coming to the treatment, antibiotics. You will give antibiotics as a pharmacotherapy and a surgery. Which surgery you will do in the sinusitis, sir? The surgery name is FES. क्या नाम है सर्जरी का? FES, functional endoscopic sinus surgery. Functional endoscopic sinus surgery. Functional endoscopic sinus surgery is your FES. So FES is used for sinusitis. Now coming to the complication of sinusitis. Very important PYQ. Complication of sinusitis. See, there is a frontal sinusitis. So frontal sinus is involved in the frontal sinusitis. Frontal osteomyelitis would be there, and because of frontal osteomyelitis, there will be subperiosteal frontal abscess. So once there is a frontal sinus involvement, there is a frontal osteomyelitis, and because of this, there will be subperiosteal frontal abscess which is collected on the forehead. And sir, remember my word, this is known as Pott's puffy tumor, which is not a tumor but it is an infection. The Pott puffy tumor is not a tumor. धोखा है भाई, धोखा है. Pott puffy tumor ट्यूमर नहीं है, फिर क्या है? इन्फेक्शन है. क्या भाई? इन्फेक्शन. ये गुड़िया का फोटो देख रहे हो, गुड़िया के माथे पे सब पेरियोस्टियल फ्रंटल एब्सेस है. दिस इज नोन एज Pott puffy tumor. दिस इज नॉट एट ऑल अ ट्यूमर. तो फिर क्या है ये है तुम्हारी इन्फेक्शन. क्या है दोस्तों? ये तुम्हारी इन्फेक्शन. नाउ सीक्वेंस ऑफ साइनस अपीयरेंस तुम्हें पहले से ही आता है. सबसे पहले जिंदगी में कौन आई? मां. कौन आई? मां. उसके बाद आया इथमॉइड साइनस. फिनॉइड 4 इयर्स में आया और फ्रंटल 6 ईयर में आया. MESF. Once question was asked about the sinus appearance sequence also. Very right. You all are right. ऑफिस हेडेक. दोस्तों ऑफिस में हम कैसे बैठते हैं? आगे माथा ऐसे करके. माथा खराब हो गया मेरा यहां काम कर करके. ऑफिस हेडेक, इट इज योर फ्रंटल साइनोसाइटिस. ऑफिस हेडेक वुड बी योर frontal sinusitis, and most common benign tumor of the sinuses would be your osteoma. Now most common benign tumor of the sinuses would be your, sir, osteoma, and the most common, it is your frontal sinus. It is your frontal sinus. So most common benign tumor of the sinuses would be your osteoma, and which sinus it is involving? Frontal sinus. So osteoma भी frontal sinus और तुम्हारी office headache भी क्या है? तुम्हारी frontal sinus. ठीक है, चलो जी. Now coming to the fungus. Most common fungus to cause the sinusitis, sir, it is your Aspergillus fumigatus. And which sinus it is affecting? It is your maxillary sinus. Sir, most common fungus to cause the sinusitis would be Aspergillus fumigatus, and Aspergillus most commonly it is involving the maxillary sinus. Now remember sinus malignancy. Most common malignancy it is seen in maxillary sinus. M for malignancy, M for maxillary. Benign wala where it is seen? Benign tumor it is seen in frontal sinus. It is seen in frontal sinus. दोस्तों ये बताओ, ये कैसा सवाल है कि ये सेशन कब तक चलेगा? ये बताओ, अगर पढ़ाई सुबह तक करके पास होना पड़ेगा तो सुबह तक बैठोगे कि नहीं बैठोगे? कि पढ़ना छोड़ दोगे? इरादा ही गलत, सवाल ही गलत और आदमी भी गलत. मेरा यार एग्जाम नहीं है, मैं लगातार तुमको पढ़ाता जा रहा हूँ, ठीक है। और मतलब तुम पूछ रहे हो कब तक चलेगा, जब तक चलेगा चलने दो ना यार। गुरु पे भरोसा बहुत जरूरी है। पढ़ाई से पहले वी नेवर क्वेश्चन अवर टीचर ड्यूरिंग द टाइम। मैं आई एम एफएमजी ना, पता है ना सबको, मैं एफएमजी हूँ, ठीक है। मैं एट द टाइम ऑफ प्रिपरेशन आई नेवर क्वेश्चन माय टीचर। मेरे टीचर ने बोला बेटा सुबह 7 बजे पढ़ने आना, मैं 7 बजे आया। मेरे टीचर ने बोला बेटा आज क्लास नहीं होगी, मैंने बोला सर नहीं होगी। आपने बोला दिन, मैंने बोला दिन। आपने बोला रात, मैंने बोला रात। ये एटीट्यूड रखना बहुत जरूरी है पढ़ाई से पहले, वरना क्या होगा ना, दिमाग आधा ऐसे लगा रहा है, क्या कर लोगे घर पे, खाना ही तो खाना है ना। खाने के लिए जीते हो कि जीने के लिए खाते हो, ये दिस इज अ डिफरेंस। एक पॉजिटिव एटीट्यूड, आए हो तो मन से आओ, ना आए हो तो मत आओ, सीधा सूला, बिंदास रहने का, ठीक है। साइनस मैलिग्नेंसी, मोस्ट कॉमन साइनस इज मैक्सिलरी साइनस। मोस्ट कॉमन मैलिग्नेंसी इज मैक्सिलरी साइनस। तुम्हें मोटिवेट होना चाहिए कि कोई बंदा जिसका पेपर नहीं है, हम में से उठ के यहां तक आया हुआ है ना, उसमें से भी कईयों को मिर्ची लगती रहती है, वो कुछ ना कुछ बोलते रहते हैं। पहले बहुत सारे आते थे, आजकल थोड़े बहुत आते हैं। पहले मुझे गलत क्या कर रहा हूँ, अगर किसी को फ्री में पढ़ाना, किसी की मदद करना गलत है तो भाई कोई बात नहीं, दे लो गाली, कोई टेंशन नहीं है। ये बंदा यहीं बैठा हुआ, जब तक ये एंटी खत्म नहीं होगी मैं खाना नहीं खाऊंगा, मैं खाना नहीं खाऊंगा, आप लोग भी मत खाओ। देखते कैसे मजा आता है। और तुमको फेल होने से कौन, पास होने से कौन रोकता है, मुझे ये बता दो। तुम्हें फेल कौन करता है, मुझे ये बता दो। जब तक मैं बैठा हूं तुम बैठ जाओ यहां तक, कैसी बात करते हो। चल, sinus malignancy, most common sinus would be maxillary sinus, would be your maxillary sinus, would be your maxillary sinus. And guys remember, canthus of eye to the angle of mandible, there is one line going, and the name of line is Ongren's line, and the name of line is Ongren's line. Below this line there is a good prognosis, and above this line there is a bad prognosis. Below this line there is good prognosis, and above this line there is a bad prognosis. This is for the maxillary sinus. This is for the maxillary sinus, maxillary sinus, ठीक है। चलो, now treatment is total maxillectomy followed by Weber-Ferguson approach. Now maxillary sinus malignancy, guys remember, treatment is total maxillectomy followed by Weber-Ferguson approach followed by your radiotherapy. Coming to the 100% exam question recently asked in the NEET PG also, mucormycosis. Mucormycosis, it is most commonly seen in the HIV positive young diabetes. Guys remember, mucormycosis, yes, last year PYQ also, guys remember, ठीक है। mucormycosis, it is seen in HIV positive young diabetes, and the clinical feature क्या है, काली काली आंखें, तुरुरु तुरुरु, ये black eyes and black nasal mask, and there is a black nasal mask, and the treatment is amphotericin B, and the treatment is amphotericin B, and the treatment is amphotericin B. Dandana 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 done. Next is rhinitis. अब नीट पीजी में क्वेश्चन पूछा था, इन्वेस्टिगेशन ऑफ चॉइस या फिर बेस्ट इन्वेस्टिगेशन फॉर द ट्रीटमेंट, इट वाज MRI. Because it goes into brain also, you have to check the MRI to treat the patient. And if it is option, it is given liposomal amphotericin B, then go for this option, ठीक है। liposomal amphotericin B, it is your liposomal amphotericin B. Dandana dandana done. Rhinitis medicamentosa. A word rhinitis medicamentosa itself is telling you something. That means it is produced by your medicine. It is due to prolonged use of decongestant. If you are using decongestant like Otrivin and other medicine for the prolonged period of time, then it will lead to rhinitis medicamentosa. Sir, now what is the treatment of rhinitis medicamentosa? Remember, stop the drops and start the steroid nasal spray. Stop these drops and then start the steroid nasal spray. Now I'll talk about the nasal polyp. I'll talk about the nasal polyp, sir. Prolapsed pedunculated oedematous mucosa of the sinus. Prolapsed pedunculated oedematous mucosa of the sinus. This is nasal polyp. Nasal polyp, sir, is further divided into two. Now, number one is your antrochoanal. Antrochoanal is also known as Killian's polyp. Antrochoanal is also known as Killian's polyp. And remember, treatment is fundoscopic endoscopic sinus surgery. You already know about the FES we did in the sinus surgery, and also endoscopic polypectomy, and most commonly it is present in the children. तो किलियंस किलकारी मारते हैं बच्चे, किलियंस, ठीक है, तो याद रखना most commonly seen in the children. Ethmoidal polyp, or it is also known as nasal polyp, most commonly it is present in the adults, and the treatment is steroid nasal spray. Ethmoid polyp बच्चों में नहीं होते, एडल्ट में होते हैं. किलियंस पॉलिप बच्चों में होते हैं, किलियंस पॉलिप बच्चों में है, और एथिमॉइड तुम्हारे एडल्ट में. एथिमॉइड किसमें है? एडल्ट में, ठीक है. चलो जी, सेम्टर्स्टाइड वाज रीसेंट क्वेश्चन ऑफ नीट पीजी, एंड दिस वुड बी क्वेश्चन ऑन 4th of June. दिस वुड बी क्वेश्चन ऑन 4th of June. आने वाला है, आने वाला कल, जाने वाला कल. सेम्टर्स्टाइड, the mnemonic is na मैनू छेड़ी ना. So all the people from Punjab, hello जी, कैसे हो, किद्दां, ठीक हो, वधिया, पढ़ाई किद्दां दी चलदी पई है तुहाडी, ठीक हो. चलो, सेम्टर्स्टाइड is na. Nasal polyp, asthma and allergy to NSAIDs like aspirin. And nasal polyp, asthma and allergy to NSAIDs like aspirin. This is known as semetostride. Recent NEET PG exam question coming to your exam also on 4th of June. Now G, a patient of anosmia can still sense ammonia. कैसे भैया, कैसे? A patient of anosmia can still sense ammonia. How is this possible? Because ammonia is not a smell. फिर भैया ये क्या है? अमोनिया अगर स्मेल नहीं है तो अमोनिया है क्या? अमोनिया है इरिटेंट. अमोनिया कौन है? इरिटेंट. एंड किसको इरिटेट करती है? अमोनिया किसको इरिटेट करती है? ये तुम्हारी ट्राइजेमाइनल नर्व. दिस इज योर प्रीवियस ईयर क्वेश्चन, सर. Now coming to the integrated topic of obs-gynae and your ENT, Kalman syndrome. There is a mutation in Cal1 gene. Mutation. There is a mutation in Cal1 gene, sir, and because of that mutation, there is a syndrome known as Kalman syndrome. And what is happening in this Kalman syndrome, sir? There is hypogonadism and anosmia. Hypogonadism and anosmia is happening there. Hypogonadism and anosmia is happening there. Now coming to the next topic, it is your deviated nasal septum. It is your deviated nasal septum and the normal septum. See, normal septum here and deviated septum here like this. I hope you all have once completed your ENT, and now whatever I am saying, it helping you to recall the things you already know. ठीक है, then only it is fruitful. If you are sitting for the first time, then only 50% I'll make sure with my effort that you will learn. But if you already know the ENT, this session would be like sone pe suhaga for you guys. Would be a golden opportunity to recall all the topics, because ENT mein I have covered approximately 90% of the topics from all the ENT, because this is a हाईली स्कोरिंग सब्जेक्ट. इसके सारे के सारे क्वेश्चन सही होते हैं, ठीक है, एक आधा कोई गलत हो जाए, वो हाईली स्कोरिंग सब्जेक्ट है, ठीक है जी. Now coming to the deviated nasal septum, guys, remember clinical presentation would be the nasal blockage, crust formation. Nasal blockage and crust formation. Nasal block हुआ, there is a crust formation. Now there is, sir, inferior turbinate hypertrophy. तो deviated nasal septum में क्या है? inferior turbinate की hypertrophy, और एक appearance देखने मिलेगी. उस appearance का क्या नाम है? मलबरी appearance. क्या appearance है? मलबरी appearance. अभी थोड़ी देर के बाद एक और बार मलबरी appearance का जिक्र होएगा, तो तब मैं पूछूंगा कि मलबरी अपीयरेंस कहां पे देखने मिली थी. योर आंसर इज डिविएटेड नेजल सेप्टम. योर आंसर इज डिविएटेड नेजल सेप्टम. देन कमिंग हाइपोस्मिया. नाउ डिविएटेड, नाक टेढ़ा हो गया. क्या है? नाक टेढ़ा हो गया है. एंड ऑल्सो देयर इज हाइपोस्मिया. एंड सर देयर इज वन न्यूरोलजिया व्हिच इज वेरी इंपॉर्टेंट, अ हाई फाई नेम, दैट इज Schleier's neuralgia. That means headache is happening. Schleier's neuralgia, that means headache is happening. So guys, remember along with me, डिविएटेड नेजल सेप्टम में एक हेडेक होती है, उस हेडेक का नाम क्या है? स्लेडर्स न्यूरोलजिया. और वहां पे इंफीरियर टर्बिनेट की हाइपरट्रॉफी होती है, जिसकी वजह से एक अपीयरेंस देखने मिलती है. उस अपीयरेंस का नाम क्या है? मलबरी अपीयरेंस. एंड देयर इज अ नेजल ब्लॉकेज बिकॉज नाक टेढ़ा हो गया. नेजल ब्लॉकेज की वजह से क्या फॉर्मेशन होती है वहां पे? क्रस्ट फॉर्मेशन. क्या फॉर्मेशन होती है? क्रस्ट फॉर्मेशन. सर नाउ द ट्रीटमेंट इज सेप्टोप्लास्टी. नाउ द ट्रीटमेंट इज सेप्टोप्लास्टी. नाउ What is the most common long-term complication of FES or septoplasty? What is a long-term complication of FES, which is a surgery used for the sinusitis? ठीक है, साइनस के लिए सर्जरी यूज है, साइनोसाइटिस की ट्रीटमेंट में फेस यूज होती है, और स्पेप्टोप्लास्टी के अंदर भी व्हाट इज द मोस्ट कॉमन लॉन्ग टर्म कॉम्प्लिकेशन? सर योर आंसर इज साइनिकी फॉर्मेशन। साइनिकी फॉर्मेशन को अब तुम्हें दूर करना है, जो लोग चिपक रहे हैं उनको तुम्हें क्या करना है? जुदा करना है। क्या करना है? जुदा करना है। तो तुम एक ड्रग दोगे, उसका नाम क्या है? माइटोमाइसिन सी, मतलब उनका काटना है। तुम्हें क्या करना है? उनका काटना है। माइटोमाइसिन सी विल रिड्यूस द साइनिकी फॉर्मेशन। माइटोमाइसिन सी विल रिड्यूस व्हाट? योर साइनिकी फॉर्मेशन. Now coming to the sir septal hematoma. Again hematoma is there. So remember hematoma में करना क्या होता है? Aspiration. Treatment is aspiration. अगर नहीं करोगे aspiration, so what will happen? There will be necrosis. There will be what? Necrosis. Now septal hematoma causes again trauma. Ear hematoma also causes trauma. Now septal hematoma will be there. Clinical condition would be nasal swelling and bilateral nasal blockage. Because of swelling there will be bilateral nasal blockage, and sir treatment is aspiration. If not done there will be necrosis, and because of necrosis there will be septal perforation. septum फट जाएगा. अब perforation किस किस वजह से हो सकती है septum की? चलो ये पढ़ते हैं कि septum की perforation किस किस वजह से हो सकती है. Most common cause of septal perforation would be sir your trauma. Next is septal surgery only. You are treating a septal and surgery and you can prick the septum. This is also a cause. Then cartilaginous part of the septum is damaged by TLL. TB, lupus, leprosy. Cartilaginous part is damaged by TB, lupus, leprosy, and the bony part is सख्त part. सख्त मैंने हार्ड, जैसे बोन है तुम्हारा, याद रखना. bony part is damaged by syphilis. Cartilaginous part is damaged by TB, lupus, leprosy. TB, lupus, leprosy. TB, lupus, leprosy. Now क्लिनिकल फीचर तो क्या है? जब फट जाती है तो क्या बोलते हैं? आजकल जैसे हो रखा है मुझे पता है, तो क्या बोलते हैं? सीटी बजा के बोल ऑल इज वेल. क्या बोल? सीटी बजा के ऑल इज वेल. क्या बोला है? ऑल इज वेल. तो विस्लिंग साउंड आती है. परफोरेशन में कैसी साउंड आती है? विस्लिंग साउंड आती है. एंड द ट्रीटमेंट इज सर्जिकल क्लोजर ऑफ द परफोरेशन बाय द सेप्टल बटन. क्या है? सेप्टल बटन. तो आजकल क्या बोला? सीटी बजा के all is well, all is well, all is well, all is well. और 4 तारीख को I will pass, I will pass, I will pass, I will pass. Yes, 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 yes. Atrophic rhinitis. अगला डिसीज कौन सा? बड़ा प्यारा डिसीज है. एक गुट पानी का पीने तो फिर डिसाइड करेंगे. एट्रोपिक राइनाइटिस. चलो जी, एटोपिक राइनाइटिस की बात करेंगे. एटोपिक राइनाइटिस इज ऑल्सो नोन एज ओजीना. Atopic rhinitis, sir, it is also known as ozena, and most commonly it is in females. Infection is by Klebsiella ozena. अब याद कैसे करेंगे? Males, what they say to female? ओ साथी रे तेरे बिना भी क्या जीना, ओ साथी रे हाय तेरे बिना भी क्या जीना. तो मेल फीमेल से कहता है ओ जीना, कैसे जीना. तो याद रखना Klebsiella ozena, and the disease is ozena, and it is most commonly seen in the female. Simple. Done, 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 done. Clinical presentation. अब ओ जीना, कैसे जीना? तो याद रखना रूमी नेजल कैविटीज. इमेजिन रूमी नेजल कैविटी, कमरे जैसी नेजल कैविटी फिल्ड विद योर क्रश. क्रश से याद रखना क्रश, तुम्हारी क्रश भरी हुई है उन कमरों के अंदर. और याद रखना पेशेंट, bad smell from patient is coming to the doctor, but the patient is not able to smell that. That is known as merciful anosmia. That is known as merciful anosmia. A patient has anosmia, a bad smell is coming from the patient, and doctor is able to feel that, smell that sense. Doctor is able to smell that bad smell. That is known as merciful anosmia, and this is a typical feature of atopic rhinitis. This is a typical feature of, ठीक है, atopic rhinitis. Now treatment is alkaline nasal douching. Medical treatment would be alkaline nasal douching. What is alkaline nasal douching? Done by, it is done with the help of powder sodium bicarbonate. It is done by the powder named as sodium bicarbonate, sodium biborate, and sodium chloride. sodium bicarbonate, sodium biborate, and your sodium chloride. Biborate, bicarbonate, and sodium chloride. Now coming to the surgery. Sir, surgery for the atrophic rhinitis, which is also known as Ozina, would be Young's operation. MCI exam question 2020 December. Young operation, modified Young operation, and Latz-Langer operation. Young operation, modify Young operation, and Latz-Langer operation, and your Latz-Langer operation. Now the next topic would be rhinoscleroma, woody nose. Rhinoscleroma, it is also known as woody nose. Cause is K. rhinoscleromatis. Cause is K. rhinoscleromatis. Scleromatis, scleroma, rhinoscleroma. It lead to scleroma, woody nose. So guys, on biopsy, previous year question is there. On biopsy of the rhinoscleroma, which is also known as woody nose, you are going to see Russell bodies and Mikulicz cells. You are going to see what? Russell bodies and Mikulicz cell. Russell body and Mikulicz cell. और ड्रग ऑफ चॉइस क्या है? टेट्रासाइक्लिन. क्या है? टेट्रासाइक्लिन एंड स्ट्रेप्टोमाइसिन. टेट्रासाइक्लिन एंड स्ट्रेप्टोमाइसिन. टेट्रासाइक्लिन एंड स्ट्रेप्टोमाइसिन. स्ट्रेप्टोमाइसिन. चलो जी, उसके बाद आया लास्ट वाला राइनोस्पोरिडियोसिस. क्या आ गई तुम्हारी? राइनोस्पोरिडियोसिस. गाइस रिमेंबर, इट इज कॉज्ड बाय राइनोस्पोरिडियम सीब्री. सी की बात हो रही है तो पानी की बात हो रही है. इट इज acquired by bathing in the pond. Guys, always in the exam, just remember my word. If there is a history given of a bathing in the pond and then some disease is asked, your straight diagnosis without even thinking twice would be your rhinosporidiosis. Would be your rhinosporidiosis, sir. It is acquired by bathing in the pond. It is acquired by bathing in the pond. And कैसी appearance है? Mulberry-like nasal mass with the epistaxis. Now mulberry-like nasal mass is there with the epistaxis. Now sir, I want to ask you a question. Mulberry-like mass is seen where? Mulberry-like nasal mass because of inferior turbinate hypertrophy was seen in which disease? Yes, love you all, and you all are correct, and your correct answer is deviated nasal septum, and the correct answer is DNS. DNS, 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 DNS. Done, done, done. Now, what is the treatment of this Rhinosporidium seabreeze? This nasal mass, which is mulberry-like, excision with the help of electrocautery of the base followed by dapsone, and this is how your mulberry-like mass is seen. Deep studies, please देख लो guys, please see to it. ठीक है, जल्दी से देख लो please see this mulberry-like mass, please see it. ये देखो, दिख रहा है सबको? दिख गया भाई? mulberry-like mass is seen, है ना? चलो भाई, उसके बाद नाक भी बंद कर देता हूँ, है ना? तो ये क्या तुम्हारा mulberry-like mass is seen. Mulberry-like mass is seen. Done, 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 done. So guys, CSF Rhinorrhea. The next topic is CSF Rhinorrhea. Causes surgery or head injury. What is the cause, sir? It is surgery or head injury, and the clinical presentation would be hello sign. Hello sign is very repeated question. You will see a CSF blood stained CSF. CSF which is blood stain, that is hello sign. It is traumatic cause. That means cause is traumatic, and most common site would be cribriform plate. Most common site would be cribriform plate, and most common site would be your cribriform plate. And diagnosis, most confirmatory diagnosis, sir, this is also your PYQ, beta 2 transferrin estimation. Beta 2 transferrin estimation. How to find the site of leak, sir? It is through the HRCT. Best is your HRCT, and the treatment of choice is conservative. Whenever a patient of CSF rhinorrhea is coming to you, what treatment you will do? Conservative. That means positional treatment, कि ऐसे सर उठा के रखो, ज्यादा हिलो डिलो मत, ऐसे ट्रीटमेंट से ही ट्रीट हो जाता है CSF rhinorrhea. और कैसे पता चलेगा? एक साइन है वहां पे, हेलो साइन. उसके बाद मोस्ट कॉमन साइट कौन सी डैमेज होती है? क्रिब्रिफॉर्म प्लेट. उसके बाद मोस्ट कॉन्फर्मेटरी टेस्ट कौन सा? बीटा 2 एस्टिमेशन, ट्रांसफेरिन एस्टिमेशन. हाउ टू फाइंड द साइट ऑफ लीक, सर? योर आंसर इज HRCT. ट्रीटमेंट ऑफ चॉइस वुड बी कंजर्वेटिव मैनेजमेंट. कंजर्वेटिव मैनेजमेंट. Then artery of epistaxis. Which is the artery of epistaxis, sir? Your answer is sphenopalatine artery. Sphenopalatine artery. And which is the most common area of epistaxis? That would be your Little's area. That would be your Little's area. Done, 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 done. चलो भाई, मैनेजमेंट ऑफ एपिस्टेक्सिस क्या है? मैनेजमेंट ऑफ एपिस्टेक्सिस, ध्यान से 7 ऑफ दीज सब्जेक्ट लाइक स्टेप्स यू लिसन एंड अप्लाई ऑन यू। सबसे पहले पिंच द नोज, सबसे पहले क्या है? पिंच द नोज फॉर 3 to 5 minutes. Then cauterization of little's area with AgNO3. AgNO3 is silver nitrate. First is pinch the nose. Second is cauterization of little's area. Cauterization of little's area with the help of AgNO3. Then third is आगे पीछे से डालना है anterior posterior nasal packing. That is known as anterior posterior nasal packing. Number 4 is sphenopalatine artery, which is the artery of epistaxis. Now you are ligating that. अभी भी नहीं बंद हुआ तो मैक्सिलरी आर्टरी के पास जाओगे, तब भी नहीं बंद हुआ तो एक्सटर्नल कैरोटिड आर्टरी के अंदर जाओगे, और तब भी बंद नहीं हुआ तो इथमोइडल आर्टरी लाइगेशन, तब भी बंद नहीं हुआ तो क्या है? इथमोइडल आर्टरी लाइगेशन। तो एक बार दोबारा से रिपीट कर लो। पिंच द नोज, cauterization with the help of AgNO3 or silver nitrate, anterior posterior nasal packing, sphenopalatine artery ligation, maxillary artery ligation, external carotid artery ligation, and ethmoid artery ligation. Maxillary, ethmoid, external carotid and ethmoid artery ligation. So guys, nose is also done. So again, if anyone want to join me anywhere on the social platform, this is my Instagram, you can add me here guys. Love you all, and 2 systems are completed. That means 70% of your ENT is now done. The only part left is your 30%, that is your throat. Now we are going to study what? Deep throat. Yes, deep throat. So all of my friends, stay energetic, पानी पीते रहो और मस्त पढ़ाई करते रहो। पहले ईएनटी की जो चैंटिंग होती थी ना दोस्तों, वो ना एक दिन ईयर होता था, एक दिन नोज होता था, एक दिन थ्रोट होता था। आज मैं इतनी बार, ज्यादा नहीं, मैंने कम से कम भी 50 बार करा दी है, और विद इन 1 year आई हैव टॉट लाइक 15,000 प्लस पीपल, 15,000 plus doctors I have trained like on YouTube, personal, individual chantings, NLC and all, like 15,000 से ज़्यादा मैं एक साल के अंदर लोगों को चैंटिंग करा चुका हूँ। दिस इज़ बिग अचीवमेंट फॉर मी, एंड मैं सेटिस्फाई हूँ कि आप लोग का रिजल्ट आए, आप लोग पास हो जाएं। असली खुशी यही है, जो आशीर्वाद आपके पेरेंट्स आपको देंगे और बदले में वो मेरे को मिलेगा। दैट इज़ द बिगेस्ट अर्निंग ऑफ द लाइफ। So guys, life is very short. Please don't argue with anyone. ठीक है, जिसको तुम्हारा साथ देना होगा वो तुम गलत भी होगे वो भी देगा, जिसको नहीं देना होगा वो जितने भी सही कर लो आप, कभी भी आपका साथ नहीं देंगे। Criticism is everywhere. Keep on working hard. You will achieve your goal very soon. You will achieve your goal very soon. ठीक है जी। Guys, let's talk about the thorax. Let's talk about the thorax. Deep throat I'm going to talk about, and now I will love to taught you pharynx. Now the first part is pharynx, nasopharynx, oropharynx and laryngopharynx. Nasopharynx, oropharynx and laryngopharynx. सर नंबर 1 क्वेश्चन इज कीलियंसडाइसिस। कीलियंसडाइसिस कहाँ प्रेजेंट होती है? यहाँ कहाँ प्रेजेंट होती है? इट इज प्रेजेंट एज इंफीरियर कॉन्स्ट्रिक्टर मसल। कीलियंसडाइसिस इज प्रेजेंट वेयर? इंफीरियर कॉन्स्ट्रिक्टर मसल सर। मोस्ट कॉमन साइट, एज आई ऑलरेडी टोल्ड यू, मोस्ट कॉमन साइट ऑफ फॉरेन बॉडी इंफेक्शन। यू कुछ भी खाते हो, लेट्स सपोज बच्चों ने सिक्का निकला, वो कहाँ पे फंसेगा सर? दैट विल स्टिक एट cricopharyngeal sphincter, which is present at level C6, Most common site of infection of foreign body would be your cricopharyngeal sphincter at C6. Now laryngopharynx, it is your laryngopharynx. This is also known as hypopharynx. Laryngopharynx is also known as hypopharynx. ठीक है दोस्तों, laryngopharynx is also known as hypopharynx. Now remember how you have to remember. Larynx is actually inside and surrounding area is known as pharynx. Larynx is inside and the surrounding area is known as pharynx. Remember, your pharynx is having pyriform sinus. These are known as pyriform sinus, followed by post-cricoid area. And area is covered by wall, that is by posterior pharyngeal wall. This is your posterior pharyngeal wall. सबसे आगे क्या है? Pyriform sinus. उसके पीछे एक area है, the name of area is post-cricoid area, followed by wall. Area is covered by wall, that is by posterior pharyngeal wall. Now, sir, most common site of hypopharyngeal malignancy would be a pyriform sinus. Most common site of hypopharyngeal malignancy would be your pyriform sinus. Would be your pyriform sinus. A laryngeal crepitus is absent in post-cricoid carcinoma. Laryngeal crepitus is commonly present in us. We are the normal people. Also, it is present in laryngomalacia, but it is absent in the people who are suffering from post-cricoid carcinoma. Now, coming to the next topic, that is your nasopharynx. Nasopharynx में number one thing we are going to study, sir, it is your adenoids. What is the adenoid site, sir? Adenoid का site कहाँ पे है? चलो मेरे साथ में याद करेंगे. Junction of roof and the posterior wall of nasopharynx. Junction of roof and the posterior wall of nasopharynx. Junction of roof and the posterior wall of nasopharynx. Now remember adenoid में खास बात, no capsule, no crypt, no definitive blood supply. No capsule, no crypts, no definitive blood supply. No capsule, no crypts, no definitive blood supply. No definitive blood supplies. ठीक है? No capsule, no crypt, no definitive blood supply, and it is present at birth. Adenoids are present at birth, grows up to 6 years of age, start declining in the puberty and disappear by 20 years of age. मेरे साथ साथ में दोबारा से अपनी अपनी जगहों पे जोर जोर से बोलना है. सबसे पहले क्या है? नो कैप्सूल, नो क्रिप्ट, नो डेफिनेटिव ब्लड सप्लाई. क्या है दोस्तों? नो कैप्सूल, नो क्रिप्ट, नो डेफिनेटिव ब्लड सप्लाई. आई एम टॉकिंग अबाउट द एडेनॉइड. इट इज प्रेजेंट एट बर्थ, grows up to 6 years age, start declining in puberty and disappear at 20 years of age. Dun 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 dun. Then coming the adenoid hypertrophy. Sir, case of adenoid hypertrophy, open mouth, pinched nose, खुला मुंह, pinched nose, high palate and malocclusion of teeth. Adenoid hypertrophy. And there is a atlantoaxial subluxation. Atlantoaxial subluxation, guys, remember, atlantoaxial joint is for yes movement or no movement. Atlantoaxial joint is for yes movement or low movement. It is for the no movement. Atlantoaxial is for the no movement. Then who is for the yes movement? Who is for the yes movement? For the yes movement, we are having atlanto-occipital joint. Atlanto-occipital joint. So atlantoaxial subluxation, this is known as Grissel syndrome. This is known as Grissel syndrome, and the treatment would be adenoidectomy in the rose position. Adenoidectomy in the rose position. So guys, angiofibroma, recent NEET PG exam question. Angiofibroma, recent NEET PG exam question. How you have to remember? Most common benign tumor of the nasopharynx. Most common benign tumor of the nasopharynx. Site of origin would be sphenopalatine foramen. Site of origin would be sphenopalatine foramen. And case how it will be coming? 12 to 14-year-old boy with nasal mass and profuse epistaxis. But in NEET PG, they have given an age of 20 years. Never ever confuse. Just a boy with a nasal mass and the profuse epistaxis. Just remember the diagnosis is your angiofibroma. Sir, in angiofibroma, frog face deformity is seen. क्या देखने मिलेगा? Frog face deformity is seen. क्या देखने मिलेगा? Frog face deformity is seen. And biopsy is contraindicated. Sir, why biopsy is contraindicated? Biopsy is contraindicated because it is highly vascular tumor. It is highly vascular tumor. Now MCQ comes on CECT. Which sign you are going to see? Sir, the name of sign is Hallman-Miller sign or antral sign. Hallman-Miller sign or antral sign. Next topic is nasopharyngeal carcinoma. Next topic is nasopharyngeal carcinoma. Etiology is Epstein-Barr virus. 2019 December FMG exam question. Nasopharyngeal carcinoma, etiology is Epstein-Barr virus. Site of origin would be fossa of Rosenmuller. Site of origin would be fossa of Rosenmuller. And the most common presentation, if I talk about, would be secondary neck node mass. Would be your secondary neck node mass. And there is very famous tride in the nasopharyngeal carcinoma, and the tride is NPC. NPC stands for nasopharyngeal carcinoma, और nasopharyngeal carcinoma में स्ट्राइड होता है, उसका नाम है Trotter's stride. N for neuralgic pain in the temporoparietal area. N for neuralgic pain in the temporoparietal area. There is a P for palatal palsy and there is a conductive hearing loss. Which one, sir? Unilateral. क्योंकि कैंसर ऐसी कोई बुरी किस्मत नहीं, दोनों कान में हो जाएगा. कैंसर हमेशा एक ही तरफ होएगा, इसलिए याद रख. हमेशा नहीं, 99% of time it is present at unilateral site only. That is why remember, sir, it is your Trotter's stride. Trotter's stride. Neuralgic pain in the temporoparietal area, palatal palsy and conductive hearing loss, that is your unilateral conductive hearing loss. The question has been asked from the treatment also, that is your chemo radiation. So nasopharyngeal carcinoma, the treatment is your chemo radiation. Now coming to oropharynx, sir. Oropharynx, remember there is vallicula, previous year question. Vallicula is a space between the base of tongue and epiglottis. Vallicula, it is a space between base of tongue and epiglottis. And bed of tonsil. Sir, bed of tonsil is made by whom? Superior constrictor muscle. It is made by superior constrictor muscle. Let's come to the tonsil. Let's compare tonsil to the adenoids. Now we have to compare this tonsil to the adenoids. कैसे compare करेंगे? आओ. Tonsil has capsule has crypt, has definitive blood supply. Capsule has tonsil has capsule, has crypt, have definitive blood supply. If no capsule, no crypt, no definitive blood supply, your answer is it is adenoid. It is your adenoid. Now most common source of bleeding in the tonsil would be your paratonsillar vein. Would be your paratonsillar vein. Now hemorrhage in the tonsillectomy is very important. Primary hemorrhage means it is happening during the surgery. Primary hemorrhage means it is happening during the surgery, and the reactionary means within 24 hours. Why it is happening? It is due to slippage of ligature. टांके क्या हो गए? टूट गए. Now what you have to do in the treatment? Immediate re-exploration. Immediately you have to remove those suture and put the new suture. This is known as immediate re-exploration. It is the immediate re-exploration. Secondary after 5 days. After 5 days, what is happening? It is due to the infection. It is due to the infection. And sir, the treatment is IV antibiotics. The treatment is IV antibiotics. Then coming to the Waldeyer's ring. Waldeyer's ring is a collection of lymphoid tissue. Waldeyer's ring, it is a collection of lymphoid tissue. And coming to the 100% question on 4th of June, this is your quinsy. So the next thing we are going to study is your quinsy. Quinsy is paratonsillar abscess. Quinsy is paratonsillar abscess, and on examination, जब तुम बोलोगे पेशेंट को मुंह खोलो तो क्या दिखेगा? Uvula, which is mainly present in the center, now it is pushed to other side. Your uvula is pushed to other side and your tonsil pushed medially. Uvula pushed to other side and tonsil pushed medially. And sir, one important thing here you have to remember, there is no outer neck swelling. यहाँ पे neck swelling नहीं होती है. Peritonsillar abscess, guys remember, peritonsillar abscess और quinsy के अंदर नहीं होती है क्या? Neck swelling. क्या नहीं होती? Neck swelling is not present there. Peritonsillar abscess के अंदर outer neck swelling is absent. Now क्लिनिकल फीचर, थ्रोट पेन, डिस्फेजिया, हॉट पोटैटो वॉइस. हॉट पोटैटो वॉइस कैसी होती है? जैसे कि मुंह में किसी ने क्या गरम गरम आलू दे दिया था, कैसे बहुत मुंह जल गया है ना, ऐसा कहते हो. फिर उसके बाद क्या? ट्रिस्मस, स्पैज्म ऑफ द मीडियल टेरिगॉइड मसल. Medial pterygoid muscle is a muscle of mastication. If it is spasm, you cannot open your mouth wide. तुम्हारा मुंह ही नहीं खुलेगा, इतना खुलेगा बस. अरे मेरे मुंह में छाला पड़ा है, दर्द हो. Treatment is perioral incision and drainage. Perioral incision and drainage. Remove the tonsil after 6 weeks. First, the patient is coming to you of the peritonsillar abscess. Sir, you have to do peroral incision and drainage. Then you have to remove tonsil after 6 weeks. This operation is also exam question. This is known as interval tonsillectomy. This is known as interval tonsillectomy. Now, why I was focusing on the outer neck swelling? Let me again take you there. If the same history like Quincy is given, that means uvula pushed other side, tonsil pushed medially, there is hot potato voice, there is trismus, there is medial pterygoid muscle paralysis. Sir, in that case, if your neck swelling is present, then your diagnosis will not be paratonsillar abscess. Now your diagnosis will be parapharyngeal abscess. Now your diagnosis will be parapharyngeal abscess. Done, 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 done. Next is Quincke's disease. Sir, what is Quincke's disease? Angioneurotic edema of the uvula. This is known as Quincke's. Quincke's is also known as paratonsillar abscess. Then coming to the parapharyngeal abscess. So, now Ludwig angina. क्या है? Ludwig angina. It is an infection of floor of mouth, that is your submandibular space. Ludwig angina is an infection of floor of mouth, that is your submandibular space. That is your submandibular space. Clinical presentation would be chin swelling, trismus plus minus respiratory difficulty, and treatment is external incision and drainage. Quincy में we were doing internal incision and drainage followed by interval tonsillectomy. In the Ludwig angina, which is an infection of floor of mouth which is near the submandibular gland, here your treatment is external incision and drainage followed by antibiotic. Now coming to the commando operation, it is done for the oral cavity. The last topic now. 85% ENT is done, friends. Just 15% left. Next 30 minutes and we are done with the ENT. So all the people who are here still to learn, they are also welcome. Who are watching late of any reason, they are also welcome. Love you all दिल से, ठीक है? हमें जबड़ा दर्द कर रहा, बहुत खंदा वाला बोलते हुए आई पूरा पेन हो रहा है यहाँ पे. So guys, larynx, deep throat. I'm going to talk about the larynx. थायराइड कैसा है? थायराइड कार्टिलेज हमारा कैसा है दोस्तों? थायराइड कार्टिलेज इज लाइक अ ओपन बुक. थायराइड कार्टिलेज इज लाइक अ ओपन बुक. और खुली किताब आदमी, खुली किताब कौन है? मैन. तो मैन के अंदर प्रेजेंट होता है क्या? एडम्स एप्पल. मैन के पास एक एप्पल प्रेजेंट होता है यहाँ पे, इसका नाम है एडम्स एप्पल. इट इज मेड बाय अ थायराइड कार्टिलेज. इट इज मेड बाय अ थायराइड कार्टिलेज. इट इज मेड बाय अ थायराइड कार्टिलेज. इट इज एडम्स एप्पल ओपन बुक. नाउ क्रिक्वाइड, राइट लाइक अ रिंग लाइक. रिंग लाइक कौन है? क्रिक्वाइड. रिंग लाइक कौन है? क्रिक्वाइड. एंड एपिग्लॉटिस वुड बी लीफ लाइक. और पत्तों से पुराने जमाने में क्या करा जाता था? अंग ढके जाते थे. क्या ढके जाते थे? अंग ढके जाते थे. दैट इज व्हाई एपिग्लॉटिस व्हिच इज लीफ लाइक, द फंक्शन इज टू कवर द vocal cord. The function is to cover the vocal cord. The function is to cover the vocal cord. Now, thyroid cartilage which is open book like, it is making what? Your Adam's apple. Cricoid which is ring like. Epiglottis which is leaf like, function is to cover the vocal cord. Now true vocal cord is known as, गले से आवाज आती है सा रे गा मा पा धा नी सा. True vocal cord is your glottis. True vocal cord is your glottis. Sir, now thyroid angle. अब देखो मेल का एंगल कितना होता है? Male angle is 90, and whenever male is looking somewhere, it angle become 120, and the female angle is 120. The female angle is 120. So thyroid angle of female is 120, and the male it is 90 degree. Thyroid angle of the female it is 120, male it is 90 degree. Sir, then coming to the keratosis larynx. Keratosis larynx is a pre-malignant condition. In some smokers, वोकल कॉर्ड एपिथेलियम शेड फास्टर. यानी कि सुट्टा पीने से जल्दी झड़ जाता है. हिंदी की तजुर्बा ऐसा है, सुट्टा पीने से जल्दी झड़ जाता है क्या? एपिथेलियम. क्या जल जाता है? क्या झड़ जाता है? एपिथेलियम. तो चीफ कंप्लेन इज हॉर्स वॉइस. उनकी आवाज कैसे निकलेगी? घोड़े जैसी आवाज निकलेगी. और ट्रीटमेंट में क्या कराओगे? स्ट्रिपिंग ऑफ वोकल कॉर्ड म्यूकोसा. In the treatment, you will do what? Stripping of vocal cord mucosa. This is keratosis larynx. Keratosis larynx. Then coming to the puberphonia. Sir, high pitch voice in male. So if high pitch voice is present in the male, this is known as puberphonia, sir, and the treatment is speech therapy. A speech therapy, which maneuver you will give, sir? It is your guts man maneuver. You will ask a man to show some guts, and the maneuver name is gut man maneuver. So puberphonia, high pitch voice in male, like a voice I am telling you. Now the surgery is type 3 thyroplasty. The surgery is type 3 thyroplasty. Puberphonia, high pitch voice in the male. So puberphonia, अगर मेल्स के अंदर हाई पिच वॉइस आती है दोस्तों, तो ये क्या है? प्यूबरफोनिया। अब इसमें क्या करो? स्पीच थेरेपी। तो क्या बोलोगे? हे मैन, शो सम कट्स। थोड़ा जोर से बोलो। तो ऐसे पीछे को धक्का देना है वोकल कॉर्ड्स को और फिर बोलने की प्रैक्टिस करनी है। अरे क्या है? गट मैन मैन्यूवर। क्या है? गट मैन मैन्यूवर। और ट्रीटमेंट में क्या करोगे? टाइप 3 थायरोप्लास्टी। ट्रीटमेंट में क्या करोगे? टाइप 3 थायरोप्लास्टी। पूरे इफेक्ट के साथ याद कराएंगे। देन क्या है? एंडोरफोनिया। एंडोरफोनिया तो कैसे बोलेगी? फोन आएगा ऐसे बोलेगी, अरे बेबी मिस नहीं कर रहे हो क्या? आज मेरी याद नहीं आ रही तुम्हें, कम वक्त कहीं के, तुमसे प्यार करके मेरी जिंदगी बर्बाद हो गई है। इफ लो पिच वॉइस इज देयर इन द फीमेल्स and it will look like a male is speaking, this is known as endorphonia, and the treatment is type 4 thyroplasty, and the treatment is type 4 thyroplasty. Yeah. Oh yeah. Then coming to the false vocal cord and true vocal cord. Sir, between false vocal cord and true vocal cord, what is present at the center? It is ventricles. What is present? Ventricle. And there is a one outpouching you can see from the ventricles. Sir, this is known as saccule. This is known as saccule. So sir, remember this saccule is known as oil can of larynx, PYQ. Saccule is known as oil can of larynx, which is outpouching through the ventricles and which is present between the true vocal cord and false vocal cord. Now, if there is an increase in size of this saccule, sir, if there is increase, टेक्निकल टीम जल्दी आओ, ठीक है। इफ देर इज इंक्रीज इन साइज, दिस इज नोन एज लैरिंगोसिल। दिस इज नोन एज लैरिंगोसिल। नाउ सर, की होल ग्लॉटिस इज सीन इन। देखो पुराने जमाने में क्या होता था? चाबी लगाते थे। पुराने जमाने में क्या होता था? चाबी लगाते थे फोन को। तो यार रखना, की होल ग्लॉटिस इज सीन इन फोनेस्थीनिया। की होल ग्लॉटिस इज सीन इन फोनेस्थीनिया। सर देन कमिंग टू वेरी इंटरेस्टिंग डिजीज दैट इज नोन एज रिंकीज एडिमा। सर रिंकीज एडिमा क्या है? एक रिंकी नाम की लड़की, रैंकी नाम की लड़की है, एडिमा और स्पेस इन द वोकल कॉर्ड। और वो क्या करती है? सुट्टा पीती है। दूसरा वो क्या करती है? गाली देती है। तो एक तो सुट्टा पीती है, दूसरा क्या करती है? गाली देती है। तो रैंकीज एडिमा, स्मोकिंग एंड वोकल अब्यूज। और फिर सर उसको क्या कराना है? जो स्मोकिंग करती है और आपको गालियां भी देती है, उसको स्ट्रिपिंग करानी है, स्ट्रिपिंग ऑफ वोकल कॉर्ड म्यूकोसा। तो बिहार, हमारे बिहार के साथ ही एक बार काल बानी बिहार वाले, चट देली मार देली खेच के तमाचा, ही हास देली रिकिया के पापा, ही हास देली रिकिया के पापा, चट देली मार देली खेच के तमाचा, ही हा ही हास देली रिकिया के पापा, ही हास देली। तो गाइस, रैंकीज एडिमा, edema of the space in vocal cord, smoking plus abuse, stripping of the vocal cord mucosa, Now vocal nodules. So guys, vocal nodule is present in whom? Singers, screamers और teachers. So ये तीनों कंडीशन किसके ऊपर लागू होती है? भगवान नजर ना लगे मेरे को किसी की, है ना? दुआएं देते रहना भाई। सिंगर्स नॉड्यूल, गाता भी हूं, चिल्लाता भी हूं और पढ़ाता भी हूं। तो वोकल नॉड्यूल्स क्या है? वोकल नॉड्यूल, इट इज योर वोकल नॉड्यूल्स। कॉज इज वोकल अब्यूज। मैं गालियां नहीं देता हूं, मैं पढ़ाता हूं, ठीक है, और गालियां खाता हूं बदले में। जो टुच्चे उच्चे लोग आते हैं गाली लेके चले जाते हैं, पढ़नी नहीं कुछ नहीं, गाली लेके चले जाते हैं, फालतू लोग। साइट इज जंक्शन ऑफ एंटीरियर 1/3 एंड पोस्टीरियर 2/3। आगे से 1/3, पीछे से 2/3। जंक्शन ऑफ एंटीरियर 1/3 एंड पोस्टीरियर 2/3। क्लिनिकल कंडीशन इज हॉर्स वॉइस। क्लिनिकल कंडीशन इज हॉर्स वॉइस, ठीक है, हॉर्स वॉइस। एंड ट्रीटमेंट इज वॉइसलेस। सर दिस इज योर क्वेश्चन। vocal nodule, if someone is getting the vocal nodules, guys, remember The treatment is voice rest. Just ask that person to please don't talk to anyone. Just take a voice rest. Don't talk, don't speak. You will be fine, absolutely fine. Now vocal polyp, cause is same, site is same, clinical condition is same. Okay, but the treatment is now changed. Treatment is microlaryngeal surgery. The treatment is microlaryngeal surgery. Intubation granuloma sir, causes faulty intubation. Causes faulty, गलत तरीके से डालोगे तो क्या हो सकता है? Intubation granuloma. So guys, treatment is microlaryngeal surgery. Treatment is microlaryngeal surgery. ठीक है, चलो. Juvenile papilloma of the larynx. Sir, juvenile papilloma of the larynx, remember source क्या है? Mother with the anogenital wart. Mother with the anogenital wart, and the most common cause of anogenital wart would be HPV-6 and HPV-11. HPV-6 recent NEET PG exam question. HPV-6 and 11. Age would be 4 to 6 year young children, and the treatment is microlaryngeal surgery. Sir, juvenile papilloma of the larynx, how it is happening? There is a history. The mother is having the anogenital warts, and the cause of anogenital wart would be HPV-6 and 11. How the case would be coming? A 4 to 6 year young children, okay, would be there presenting with the juvenile papilloma of the larynx, and the treatment, sir, you will go for the microlaryngeal surgery. Would be your microlaryngeal surgery. Now the most common laser used in the larynx surgery would be CO2 laser. Most common laser used in the larynx would be your CO2 laser, sir. Let's talk about the PYQ topic, that is your adult and pediatric larynx. Adult and pediatric larynx. Pediatric and adult, remember the position. Pediatric में क्या होता है? बच्चे साथ साथ खेलते हैं और बच्चे साथ साथ ही खेलते हैं, C2 C3. Adult थोड़े दूर दूर होते हैं, C3 C6. Pediatric position is your C2 C3. Pediatric position is your C2 C3. Adult it is your C3 C6. Now बच्चे सबको पसंद है तो narrowest part with भी सबको पसंद है सबग्लॉटिस, और एडल्ट एक दूसरे की जी 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 लेते रहते हैं तो ग्लॉटिस. क्या है? ग्लॉटिस. तो पीडियाट्रिक इट इज सबग्लॉटिस, एडल्ट इट इज ग्लॉटिस. एडल्ट इट इज ग्लॉटिस. पीडियाट्रिक सबग्लॉटिस, एडल्ट इट इज ग्लॉटिस. एडल्ट इट इज ग्लॉटिस. सो एक्यूट एंड पीडियाट्रिक लैरिंग. पीडियाट्रिक पोजीशन इज C2 C3, adult position is C3 C6. Narrowest part in pediatric would be subglottis, and adult it would be glottis. Adult it would be your glottis. Then chalo, indirect laryngoscopy is an indirect laryngoscopy do not show what? Anterior commissure of the vocal cord. Indirect laryngoscopy, what it will never show? It will never show anterior commissure of the vocal cord, sir. So let me make you perfect with the stridor. Stridor is known as noisy breathing. Stridor is known as noisy breathing. जो खराब आवाज आती है. अब कहाँ कहाँ पे ऑब्स्ट्रक्शन होगा और कैसी कैसी आवाज आएगी, ठीक है? कहाँ कहाँ पे ऑब्स्ट्रक्शन होगा, कैसी कैसी आवाज आएगी. देखो, अगर इंस्पिरेटरी स्टाइडर आई एम सेइंग मीन ऑब्स्ट्रक्शन इज समवेयर फ्रॉम द फ्रंट. इफ एक्सपिरेटरी स्टाइडर इज देयर मींस ऑब्स्ट्रक्शन इज इनसाइड. If biphasic is there, mean obstruction is in the middle. So let's talk. Inspiratory stridor means level of obstruction is supraglottis. Done. Biphasic it is glottis and subglottis. Supraglottis के बाद आता है glottis और glottis के नीचे आता है subglottis. That is why biphasic में level of obstruction would be glottis and subglottis. Sir, expiratory means air is coming outside. Bronchi and trachea. Outside air is coming from inside to outside. Now there is an obstruction, and that will produce what? Expiratory stridor. Thoracic and bronchia. Thoracic, trachea and bronchia is our answer. ठीक है जी? चलो. Now abductor muscle is your posterior cricoarynoid. Who is the abductor muscle of your vocal cord? Sir, your posterior cricoarynoid. Main tensor would be your cricothyroid. Main tensor would be your cricothyroid. ठीक है, cricothyroid. And quality of voice is vocalis. Who maintains the quality of voice? Sir, your answer is vocalis. Now, vocal cord paralysis is mostly happening on the left side. Why? Why it is happening on the left side? Your answer is very much Very much clear, because of longer course of left recurrent laryngeal nerve on the left side. That is why vocal cord paralysis is mostly happening on the left side. Ortner syndrome was also NEET PG exam question. There is a left recurrent nerve palsy. How it is possible? There is a left atriomegaly. Left atria is now enlarged, and which is compressing your left recurrent laryngeal nerve, and that is why one syndrome is happening that is known as Ortner syndrome. So now let me make very simple for you. Bilateral abductor palsy. Bilateral abductor palsy, remember, abduction is absent. Bilateral abductor palsy means abduction is absent, and now your vocal cord is like this. Your vocal cord is like this. Your vocal cord is like this. Now you have to treat this condition. So you have to open this vocal cord, and now your open vocal cord will become like this. So sir, this will become 2. This will become 2, and you can see on the screen bilateral abductor palsy. The treatment is type 2 thyroplasty. Clear, simple. Then coming to bilateral adductor palsy means what? Now your vocal cords are like this, opened. Your vocal cords are like this, and you have to close your vocal cords. Now you will close your vocal cord like this. So sir, it will become number 1. So in treatment you can see what it is, your type 1 thyroplasty. The treatment is type 1 thyroplasty. The treatment is type 1 thyroplasty. Clear hai? So sir, type 1 thyroplasty is done for the bilateral adductor palsy. Okay, bilateral adductor palsy. Then type 2 thyroplasty is done for the bilateral abductor palsy. Type 3 is done for the puberphonia, and type 4 is done for the endorphonia. Type 4 is done for the endorphonia. Now, if superior laryngeal nerve is injured, there will be bowed down vocal cord. If your superior laryngeal nerve is injured, it will be what? Bowed down vocal cord. And if there is a laryngomalacia, there is always question. So question is coming, friends. Stridor is present. Which stridor? Inspiratory stridor is present. That means obstruction is at which level? Yes, you are very much correct. This is your supraglottis. Obstruction is at supraglottis. What is a typical feature to solve the case of laryngomalacia other than your omega sign? Sir, it is your stridor, that means inspiratory. Now it will increase. Stridor will increase on crying and decrease on prone position. Ulta लेटते कम हो जाएगा, रोने से बढ़ जाएगा. This is a case of laryngomalacia. This is a case of laryngomalacia. And guys, remember, examination you will see omega shape epiglottis. And cry sound is very much normal. Cry sound is very much normal. And the treatment is conservative management. Now, congenital laryngeal web. Most common site would be glottic web. Most common site would be glottic web. And now cry sound is abnormal. If I'm talking that cry sound is normal, I'm talking about laryngomalacia. If I'm saying cry sound is abnormal, that means I am talking about the congenital laryngeal verb, and treatment is CO2 laser. This is not very important. What is important is laryngomalacia. You will never forget what? Laryngomalacia. Now, pediatric laryngeal infection we are going to talk about. Number 1, it is your acute epiglottitis. Sir, acute epiglottitis causes streptococci. Age group is 2 to 7 years. So remember, acute epiglottitis cause is streptococci and the age is 2 to 7 years. Age is 2 to 7 years. Clinical presentation: a very sick child. Respiratory distress is present, and child sits in bending forward position, that is known as tripod. So first clicking word is your tripod sign here. Acute epiglottitis, tripod sign is positive. What is positive? Tripod sign is positive. There is a very sick child. Respiratory distress is present there. There is a drooling of saliva. For this child, if we are performing an X-ray, sir, we are going to see, in the case of acute epiglottitis, we are going to see what? Thumb sign. We are going to see what? Thumb sign. Tripod sign, thumb sign, typical features of acute epiglottitis. It is a typical feature of the acute epiglottitis. Done, 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 done. Now treatment, sir, there was respiratory distress. That is why airway ABC management is very important. So at first we are going for the first intubation, maintain the airway, then coming to the steroid, then coming to the antibiotics. First preference is airway, that is why intubation. Second is steroid, and the third is antibiotic, and the third is antibiotics. Then coming to the acute laryngeotracheal bronchitis, or it is also known as croup disease. It is caused by para-influenza virus. Acute laryngeotracheal bronchitis, it is caused by para-influenza virus. Age is 3 months to 3 years. Age is 3 months to 3 years. Clinical presentation, respiratory distress, biphasic stridor. Sir, can you tell me biphasic stridor is obstruction at which level? Obstruction कौन से level पे है आपकी बात? Glottis and subglottis. The obstruction is at glottis and subglottis, and there is a barking cough. तो क्रूप डिजीज के अंदर बार्किंग, कुत्ते जैसे, कुत्ते कैसे करता है, भाव 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 भाव, and on x-ray you are going to see, sir, steeple sign. This is a typical feature of your croup disease. Steeple sign is seen on the x-ray. This is your steeple sign. On 4th of June, either steeple sign is coming or either your thumb sign is coming. That is my guarantee to all of my friends who are on board right now with me. This is your steeple sign. This is your steeple sign. Sir, again the treatment is airway because there is respiratory distress, then steroid, then antibiotics. Then coming to the next thing, that is a 2 sign of TB larynx. 2 sign of TB larynx, sir, turban epiglottis. पहला नंबर है, चूहे ने क्या पहनी, टोपी पहनी, टर्बन एपिग्लॉटिस, और इट इज आल्सो नोन एज माउस निबल अपीयरेंस. माउस निबल अपीयरेंस, टर्बन एपिग्लॉटिस एंड माउस निबल अपीयरेंस. ठीक है जी. उसके बाद है फंक्शनल एफोनिया, hysterical aphonia. It is also known as hysterical aphonia. Functional aphonia, how you will get to know about this patient? A very beautiful 20-year-old young female would be coming to you and she'll be pretending that she can't speak. Now you are a very trained doctor of NLC YouTube channel, and Dr. Paras has take you chanting, and take that girl at sight. Come, please come near and do one thing. Cough. Let me check you. This is a test. Cough. And if that suddenly that woman coughed in front of you, that means what? She was making you see. She was making you see, and you will come to know she is faking the condition. That is why the treatment of functional aphonia would be psychotherapy. The treatment would be psychotherapy, and treatment would be psychotherapy. Now coming to, sir, cancer larynx. Age group is 40 to 60 year. Cancer larynx, the age group is 40 to 60 year. Risk factor would be smoking and alcohol. तो गले में कैंसर हो सकता है ग्लॉटिक कैंसर, सुप्राग्लॉटिक कैंसर एंड सबग्लॉटिक कैंसर. तो क्या क्या है? ग्लॉटिक कैंसर, सुप्राग्लॉटिक कैंसर एंड सबग्लॉटिक. ग्लॉटिक, सुप्राग्लॉटिक एंड सबग्लॉटिस. Out of these, remember, glottic cancer, most common type, no neck node metastasis is present, leave. Then coming supraglottis cancer, site is epiglottis. Site is epiglottis. Feeling like lump in the throat, dysphagia and hot potato voice. Subglottis mein what is present? Stridor is present. Now treatment is same for all of them. Remember the treatment, stage 1 and 2 you have to give radiotherapy. Stage 3 and 4 you will go for the total laryngectomy followed by radiotherapy. Stage T1 and T2 you will go for the radiotherapy, sir, and stage T3 and T4 you will go for the total laryngectomy followed by radiotherapy. Total laryngectomy followed by radiotherapy. नहीं नहीं, ऐसा कुछ नहीं है यार. नारियों का मैं बहुत सम्मान करता हूँ. अब वो केस ऐसा दे रखा है तो मेरी कोई गलती नहीं है ना. आई नो, वो सच्चाई की मूरत है, वो बहुत ही शक्तिशाली जेंडर है, उनका नाम फीमेल है. मैं बड़ी इज्जत करता हूँ उनकी, हमेशा करता रहूँगा, क्योंकि मुझे बहुत पसंद है उनकी इज्जत करना. T1, T2 is radiotherapy. T1, T2 is radiotherapy. T3, T4 is total laryngectomy followed by radiotherapy. Now voice production after the laryngectomy. Now you did laryngectomy, how the voice will come, sir? How the voice will come, sir? ठीक है. सबसे पहले है esophageal voice, यहाँ पे पंचर करके esophageal voice, पुअर मेथड, नहीं 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 नहीं. उसके बाद है electrolarynx, सर, artificial larynx. ये देखो, she is using what? Vibrator. ये मोहतरमा क्या यूज कर रही हैं? वाइब्रेटर यूज कर रही हैं. क्या प्रोड्यूस करने के लिए? आवाज प्रोड्यूस करने के लिए. वो आवाज कैसी हो सकती है मुझे अब बताने की जरूरत नहीं है. वो बड़ी प्यारी से आवाज आएगी वाइब्रेटर के थ्रू, जो आवाज प्रोड्यूस करी जाएगी. ठीक है दोस्तों. तो अब ये वाइब्रेटर, ना हाउ टू डिफरेंशिएट अ वाइब्रेटर, दैट Vibrator which is used down and a vibrator which is used up. Let me take you very simply. देखो इसका ऊपर से टोपा कैसा है, फ्लैट है, और जो वाइब्रेटर नीचे यूज होता है वो कैसा होता है, है कि नहीं? सो दोस्तों, इलेक्ट्रोलैरिंक्स, ये देखो कितनी खुश है वाइब्रेटर यूज करके. हाउ हैप्पी शी इज आफ्टर यूजिंग द वाइब्रेटर. तो वाइब्रेटर लाओ तो जिंदगी में खुशियां ही खुशियां हो जाओ. ठीक है. सो गाइज, नेक्स्ट इज ट्रैक्यो इसोफेजियल पंचर डिवाइस विच इज अ बेस्ट डिवाइस, which is a best device. And at last, just remember 2-3 words and we are done. High tracheostomy is done at first and second ring, which is done in cancer larynx. Mid tracheostomy is done in second and third ring. Mid tracheostomy second and third ring. High tracheostomy first and second ring. If tube get blocked, ये बड़ा क्वेश्चन आता है भाई. If tube get blocked, remember, if tube get blocked after tracheostomy, what you have to do? तुरंत निकालो और नया वाला डालो. तो इंग्लिश में कैसे बोलेंगे? रिमूव द ट्यूब एंड इमीडिएटली पुट द न्यू ट्यूब. पुरानी वाली निकालो और नई वाली डालो. डन 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 डन. ई एन टी ओवर. नाउ इट्स टाइम फॉर द क्वेश्चंस. ये नहीं खोलना है, दूसरी चीज खोलनी है. मैंने तैयार करे हैं तुम्हारे लिए सवाल. उन सवालों के तुम जवाब दोगे और तुम लग जाओगे तड़ी पार. यस 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 यस. हो बातें ये कभी ना तू भूलना, कोई तेरे खातिर है जी रहा. ये क्या हो गया? कहाँ गया? चलो, क्वेश्चन नंबर 1 फॉर ऑल ऑफ माय फ्रेंड्स ऑन बोर्ड राइट नाउ विद मी. चलो जल्दी से क्वेश्चन नंबर 1 का आंसर दो. इफ अ 15-year-old presented with a chief complaint of epistaxis with a red nasal mass protruding out, your diagnosis is, sir, your diagnosis is, जल्दी से, your diagnosis is, what is your diagnosis? What is your diagnosis? क्या बात है, जवाब कैसे सड़े हुए जवाब आ रहे हैं आज, क्या बात है भाई. ये ऑप्शन देख लो एक बारी जो छुप रहा है. सर, वेरी मच करेक्ट आंसर इज योर जुवेनाइल नेसोफेरेंजियल एंजियोफाइब्रोमा. पढ़ाया था ना, एपिस्टेक्सिस. यस, डन डन डन. करेक्ट आंसर इज डी. नाउ आइडेंटिफाई द कंडीशन दैट अपीयर्स विद द बी टाइप. बी 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 भरा हुआ. क्या है भरा हुआ? क्या याद आ रहा है इससे? टेम्पैनोग्राम में बी कर्व किसके लिए था? बी कर्व वाज फॉर, बी कर्व वाज फॉर, बी कर्व किसके लिए था? बी कर्व वाज फॉर, your very much correct answer is your glue ear. The very much correct answer is your glue ear. Done. Then coming to the thumb sinusine. Thumb sinusine. Thumb sinusine में अभी अभी देखा था. Thumb sign, tripod sign भी था उसके अंदर. Respiratory difficulty भी थी उसके अंदर. Yes, yes, yes. What is a diagnosis, sir? Sir, your diagnosis is acute epiglottis. Number 4, which is the artery of epistaxis. Yes, epistaxis. I have taught you and I deserve an answer from you guys. Artery of epistaxis would be your, yes, correct answer is sphenopalatine artery. The artery of epistaxis would be your sphenopalatine artery. Then potato nose is seen where? आलू खिलाया था तुम्हें, है ना? आलू खिलाया, आलू 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 मेरी जान, मैं तेरे कुर्बान, तू मेरा मैं तेरी जाने सारा हिंदुस्तान. तो दोस्तों, सही जवाब की बारी आ चुकी है. राइनोफाइमा इज अ करेक्ट आंसर. Laryngeal crepitus is seen in all except. Laryngeal crepitus is seen in all except. Laryngeal crepitus is present where? It is absent. It is present in all except post-cricoid carcinoma. देखो, laryngitis में भी होता है और present in the normal humans also. And right now we have studied in today's lecture only. It is absent. It is absent in post-cricoid carcinoma. Now treatment for the teacher's nodules. Yes, teachers nodules का treatment. What is a treatment for the teachers nodules? Treatment for the teachers nodules would be, the treatment for the teachers nodule would be, the treatment for the teachers nodule would be your, what is your answer, sir? Teachers nodules, your treatment would be voice rest. Your treatment would be voice rest. And the most important wave in the vera, vera की 7 wave थी, उसमें से सबसे important wave कौन सी? Tell me the answer, which is most important wave in the vera. Most important wave in the vera. Which is the most important wave in the vera, sir? Sir, your answer is wave 5, C option. Question number 9. Wet newspaper appearance is seen. Sir, wet newspaper is seen in where? Wet newspaper appearance is seen where? Wet newspaper appearance is seen where? You're very much correct answer. It is seen in otomycosis. It is seen in otomycosis. Now, 10th question. How was today's session? आज का session कैसा लगा? Yes. To contact us, let me give you NLC Delhi 777-000-3686, NLC Calicut. It is your 9388082020. So for joining me on Instagram, you can send request on P Jamwal 7. Dandana, 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 done. So guys, we are done with our today's ENT session. I just took 2.3 like 2.25 hours. मेरे को उम्मीद थी 4 घंटे लगेंगे, बट पहली बार ऐसा हुआ इतनी बड़ी ENT 17 नंबर की ENT we have finished in just 2.5 hours. Just 2.5 hours and it is completely done. Love you all. Stay tuned. ठीक है? Okay. Tomorrow we are going to do the biochemistry. Biochemistry. Yes. Chalo. So, das vidaniya. Good night. Love you all. Stay motivated. Just stay positive. You all are going to pass. इसी के साथ अलविदा दोस्तों. जय हिंद, जय भारत. Love you all. ट्रक भर के. Love you all. Keep supporting, keep learning, and do post your pictures with a result, positive results. ठीक है? और if you want to do what things you can do on Instagram, just tag me while studying the chanting. You can tag me while studying the chanting by posting the picture on the Instagram and I'll repost it for you guys. It's just a token of motivation for all of you. Chalo. The technical staff, I'll request to stop the stream now.